Susan, maybe turn off your camera too.
I will do that.
Thank you. And you guys see a big version of the screen, huh?
Yep.
Ooh, how do I make it bigger here?
Well, it's moving, he's moving it around, so it's not in my control.
Well, it's still, now it's hard for you to manage on your end, right?
Yeah. Yeah, I can't.
Do you want to just look at it on your laptop here, and then you can use the keyboard to arrow through the slides? I'm sure there's a better way.
Yeah, but how do I make the view better here? We either have a good view at. Do you see the whole screen? Do you see the whole presentation? I can't press them.
Is there some other place that you can toggle it from?
See the whole
Like-
presentation, right?
See, the problem we're getting, they see just the presentation, right?
Yeah, yeah.
So let me get rid of my camera. Turn off camera. That's
Now
better.
we have a, now we don't see you and have this
They want to see
presentation on the screen.
Camera, turn on camera. Can I minimize my,
Yeah.
here, let's see. Toggle full screen. Minimize me, mute me, pin me, edit me,
If you
spotlight me.
pin you, it might make you smaller. Yeah. Oh,
Nope.
yeah, the
The
opposite.
other one. There
Pin
you
the
go.
other one. Yeah.
Oh, there we go.
Yeah, that's it.
Yeah,
For you.
that's gonna be hard to see.
Can you can't pull it to make it
And
larger?
now
Oh,
hit one
look
of
at
these
that
guys.
little, this little gray.
What?
Yeah.
I can't say I'm loving this new GoToWebinar.
No,
Yes.
no.
Yeah, I don't know. It's hard to.
I was just.
There's
I'm doing
definitely
this.
a learning curve.
There's a big learning curve.
You
on
might-
this one.
Off and then.
You might,
Hey, that's-
yeah, I just said there's no active cameras.
They can see. Yeah, that's right.
This is
Okay.
the best
So when I start the presentation, I will go off camera.
Can you advance your slides?
No. Nope.
Can you advance the slides from the GoToWebinar? Because there's a slide advance thing at the bottom on a
Where?
white. What I see on my screen,
Control.
yeah, what I see on my screen is a slide, a lesser than arrow, and then a thing that looks like a page, and then a greater than arrow.
I see that, but when I press on it at the bottom of the screen, nothing happens.
Can you advance it from your either your arrows on your keyboard? Because sometimes
No.
that.
No,
Hmm.
doesn't work. Doesn't work.
How did I've had that happen when I've been presenting before.
The keyboard works, right?
Yeah.
Like the up and down arrows versus the back and forth
I'm
arrow?
doing right, left, up, down, nothing.
Nothing. And Mercury is not in retrograde.
Jim, can you present just directly from the PowerPoint? In other words, get out of the GoToWebinar screen and just go to your PowerPoint screen.
Somehow make you the presenter.
Am I the presenter? Is that the problem?
It's acting,
You
you don't have control over the PowerPoint.
Lisa's saying it's acting like I'm not the control. Okay, so control. I'll say control to Jeff. And maybe now I'll have control. Let's see. Nope.
So what would happen? What would happen if you, instead of looking at the GoToWebinar screen, that you go and look at your PowerPoint, have that window, that PowerPoint window foremost, and then just work through that, as Jeff suggested.
Yeah, that works.
There you go.
Do you see it now?
I see you went back to the hand screen, but I saw a screen with printing on it.
Okay, so maybe
then
just
you wanna
make
make
that.
that
So now I see the title page right now. But when you experimented,
Your whole screen, they should
it-
be able to see it.
it showed that all. When you experimented with using your
Yeah.
PowerPoint window,
Now see,
Oh,
does it go?
work.
Yeah, it does. There you go. Yay.
Paul said you have to use screen share to advance the slides.
And now you're back to
and
the
now you're back to
presenter.
presenter mode, yeah. It's fine.
You guys can see? I
We're
mean,
back,
we're good here on our end, but I don't know what you can see.
we see presenter mode, but that's fine.
Yeah.
Oh, as long as it works.
That's what you said. Okay. Yeah, this is the problem. It'd be great if we could get full screen both, but
Tim, can you lower your click to add notes, that bar right above where it says click to add notes? Can you drag that bar down or?
Yeah, that's,
Yeah.
No,
Make-
go to webinar,
I mean, is it on?
not the camera.
there you
There
go,
you go.
there you go.
Yeah, now, Tim.
that's better.
Yep.
Yeah.
Yep. Now you can click on your slides on the left and just advance that way.
Yeah, that's it. They can see it fine from Francie.
Okay. You guys are good now? Yeah, you're still presenter mode. That's all right. I think that's the best we're gonna get.
I wonder from Francie's, can she hit slideshow from there and then make it full screen for her?
Bob, I think this is making a strong argument. I mean, Jeff, for
You're-
Zoom.
You're liking Zoom more and more today?
Seems like it'd be easier.
I couldn't agree more, but again, go to
But
webinar.
like you said, Jeff, it's your call, and there's pluses and minuses.
Yeah, no, I'm gonna call them again. I mean, they took like a week to get back to me. Yeah.
I think they're not going to get back to you. They want the money, so but
Yeah.
it's when the renewal comes up in October or whatever. That's when the decision happens.
Oh, I'm gonna cancel it now. I just don't know what's gonna happen.
Yeah.
How did we contact you? You all.
Get started. Bob, you want to?
All right. Without further ado, we would like to introduce Dr. Tim Fior, but first of all, welcome everybody to the April 2026 joint meeting of Illinois Homeopathic Medical Association and the Academy of Veterinary Homeopathy. So we have two really great speakers today. And first, we're going to introduce Dr. Timothy Fior, and he's going to speak, as you can see, on the homeopathic treatment of the patient with rheumatoid arthritis. I'm really looking forward to this presentation.
Excuse me, Bob, are you recording?
Okay, thank you. So originally I was asked to do this presentation for HAMP. They're putting together a lecture series on different topics. And also Oran has asked me to give the same talk. So this was my first run through. We'll see how it goes. Let's see. So what we're going to talk about is rheumatoid arthritis. I'm going to show one patient with rheumatoid arthritis and follow over time. We're going to look at some characteristic rubrics and remedies, common remedies. But the way it works in homeopathy is you have to take a complete history, and any remedy can be used for any condition at any time, right? That's just the reality. That's the same for every other condition. Now, of course, if there's trauma, maybe we think of arnica first. But if the person is in a frightened state, maybe they need aconite. Or if they're in a totally collapsed state, maybe they need camphora. So, you know, we have certain clinical indications, certain remedies needed for certain clinical indications, but you have to keep an open mind and always individualize. So you have to take a complete case, history, and exam. If you're doing virtual, then you always want to examine certain parts of the patient. You want to look at their face. You want to look at their teeth or ask about their teeth. Look at their nails. See for spots and brittle and deformity of the nails. You want to look at their feet. Any other lesions. And then once you take a complete history, you want to analyze the case to see what's most characteristic, paragraph 153. And you want to prescribe on the totality of the characteristic symptoms, give optimum posology, and as you manage the case over time, this case will show that you're going to, with a chronic condition like rheumatoid arthritis, you're going to need to change remedies. One remedy is not going to cure the patient. Typically, you're going to have to go from remedy to remedy to remedy. In fact, this is a case where the patient is not cured. She's much better, but that's how it goes often. So paragraph 153 from the Organon, 6th edition. In this quest for a specific remedy, the more striking, strange, unusual, peculiar, characteristic signs and symptoms are especially, almost exclusively, the ones to pay attention to, because it's these which correspond to very similar symptoms in the symptom list of the medicine being sought, if it's most suitable. So you want to take out the characteristic symptoms.
Not moving.
What's not moving?
Are they seeing this?
The slides are not moving, guys. What's up?
Where are you trying to move them from?
Oh, no, I mean, they're not progressing. I'm already on my 3rd slide.
Have you clicked on them on the left? We're looking at your presenter view. It has your only first slide.
Paul said you're supposed to
There you
share
go.
the screen.
There you
There
go.
you go. There you go.
Yeah,
Now move?
yeah, now it's mirroring your screen.
Okay, but what if I do this?
Yeah, now you're okay.
Yeah, now I'm following.
Now you see it okay? Okay. So
The
paragraph
slide that's up now is your 3rd slide, Organon 6th edition,
Perfect.
paragraph 153.
So you basically take the history, you see what's most characteristic, you have a list, and then you try and match it to a remedy, which remedy has those characteristic symptoms most closely. Okay? And then paragraph 171, in non-venereal chronic disease, usually arising from psora, one often needs to use several antisoric remedies in succession to bring about a cure. And this is a case you'll see that. We go from, and there's actually a trio of remedies that we use. And each to be chosen because it is homeopathic to the group of symptoms remaining after the previous one has completed its action. And this is what happens when we treat people chronically. They start with a certain group of symptoms, and certain symptoms fall out, other symptoms get accentuated, and new symptoms come, and you look at that new picture, you prescribe another remedy for a while, go up in potency, then the picture changes, you prescribe. It's like if anyone sails, it's like tacking in a sailboat. You keep one remedy for a while, you go as far as you can, then you tack back the other way. All right, so this is the case. I'm going to present the case when up to the point where I got it. Then we're going to go through some repertory and materia medica, and then we'll go back to the case.
It didn't switch slides.
It didn't switch slides.
1, 3.
What are we missing, guys?
Where are you trying to move the slides from? Are
I'm
you
moving
using-
the slides on my screen, which is full screen.
Yeah, toggling them.
Yeah.
What seems to be working for us in GoToWebinar land there is clicking on that moved you to
I have that one.
the,
Okay.
Problem
The-
that you have two
yeah.
PowerPoint screens up, or-
Now I can't move this. It doesn't toggle. There's no toggle. There's no toggle.
That's a pinned screen.
Maybe
That
I
may be. Did you pin the screen at the beginning?
Yes.
That may be why.
So I unpinned it, I think. How do I unpin it? Nobody has shared their screen. Okay, share. Share something else.
Sharing it.
I'm sharing it, but now I can't advance it.
Because it's pinned. Some reason, there it goes. I'm on the 4th slide now.
Yeah. So it says MA with rheumatoid arthritis for 24
Yeah,
years.
slide 4.
Yeah, that's the screen that I see out here.
Okay, now I can't, you can see it and I can't move the screen. So I'll go back into PowerPoint and then I'll be able to move it maybe, but. Now can
we're
you see it?
seeing- Yeah, now we're seeing RA history. Now we're back at the signalment.
If you slide where it says 52%, if you slide this a little
On
bigger,
the top
it might
right.
make a bigger screen maybe.
No, go to the top of the screen. The red top
Right there.
is the X and then there's the big box.
Right there?
Yeah.
Does that do it?
Just
To the right.
How's that?
Yeah, and then we can make it a little bigger.
Now we see presenter mode with slide number 4 with the
Is
signalment
it
on it.
advancing now?
Well, see if it advances.
Does it advance?
It has not advanced.
Or,
No, yeah, it's not.
The suggestion was made earlier, Jeff suggested that you're going to have to advance it in the presenter mode by clicking in the left margin on slide 5. Advance
Yeah.
it that-
How's this? Can you see the advancing now?
Yeah.
4, 5, 6.
Okay.
Yes.
it's
Yes. Yes.
Okay.
moving, it's moving, okay.
And
All
we
right.
can make it a little bigger. So,
So we're back on slide 4 with the signalment.
yeah, and they could just
There you go.
tag
There
on.
you go.
Okay. So MA, she's a 66-year-old white female. She was diagnosed with rheumatoid arthritis in 2002 by a rheumatologist. The interesting thing about her diagnosis, she had a positive rheumatoid factor. Usually with rheumatoid arthritis, you want a history, like the morning stiffness. You want to have pain in the joints, swelling, and you want a positive factor, a positive rheumatoid factor or an anti-CCP antibody, and maybe some constitutional symptoms too. She did not have swelling. Now it's interesting, when I looked that up, when people have swelling, they actually respond better to biologics because there's inflammation in the joint, there's synovitis. And you look for, in rheumatoid arthritis, it's typically the MCP joints, right at the knuckles that are swollen. And the swelling is kind of doughy or soft, spongy. With rheumatoid, with osteoarthritis, it's the DIP joints, right by the nails, and they're bony, hard. Now, rheumatoid arthritis with swelling, they tend to get erosions. When you don't have swelling, you don't tend to get erosions of the bone, but you'd think there's a better prognosis. There actually could be a worse prognosis because those people tend to have more pain, and oftentimes they don't respond to biologics. And like you'll see that for her, she didn't. And she didn't get biologics, but she got the usual drugs and didn't respond and actually had side effects. So it doesn't necessarily, just because there's no swelling, doesn't mean it's a better prognosis. You sometimes can have more disability. She had a history of recurrent UTIs. With homeopathy, it's not just treating the joints, we're treating the whole person. 1 or 2 times a year, allergies, migraines, and she had keloids on her right breast after a mastitis with her children and on her hips and buttocks. So she had a tendency to form keloids. That's important for us homeopathically. She was initially treated by the rheumatologist with NSAIDs, then Plaquenil, which was used a lot during COVID. Although you had to be careful, if you prescribed it, you got canceled. Methotrexate, which is a really strong drug that can cause liver failure, and intermittent steroids. She had to discontinue the methotrexate because it elevated her liver enzymes. So she basically had no success with conventional treatment. So she began homeopathy in 2005, and she's been off conventional rheumatologic drugs since then. So 21 years now. Now, as often happens, I wasn't her first homeopath. I was actually her third or fourth. Fourth. So other history, she had the UTIs, allergies, migraines, keloids. The keloids were treated by steroid injections 2 or 3 times a year for several years. And no one had said anything about that. What do you think about that? Just continue. Lisa's shaking her head no from side to side. Any other comments? Or
It was helping the keloids or no?
well, it wasn't taking them away. It would regress them, and then they would start getting big again. So actually what I told her is, look, we need to have you stop that, and the keloids are going to get worse, but we need to get you continually better. We need to get you off that. She had heavy menstrual bleeding around menopause, because when, again, in 2005, she was like 46 or so, 45. And they controlled it with an IUD. They placed an IUD, which to me makes no sense. But after beginning homeopathy, her first homeopath, who was actually one of the editors of the 6th edition of the Organon, a French homeopath, who's a lay homeopath, he told her to get the IUD taken out, which I agree with. I had a patient who came to me because she had normal periods, and then she went to the gynecologist, and they like to do their thing, and they said, oh, let's put in an IUD so you don't take the pill, right? They put in an IUD, and she had normal periods, no cramps ever in her life. They put in the IUD. She had horrible, severe cramps. It was a copper IUD, and which is a known side effect. And we know in homeopathy, copper causes spasms, cramps. She had it taken out. She still had severe cramps. It's like it was a kind of continuing effect. She did well with sepia. We tried sepia, a few other remedies, and she's doing better now. But you know, these interventions that they do for birth control and other things, the hormones, I find patients are almost always better off, and it's easier to treat them when they're off those things. But that's what they use in conventional. She was treated successfully with pulsatilla for 17 years. She had a wandering arthritis. When you see wandering arthritis, wandering means one day it's in the hip, a day or two later it's in the shoulder, then it's in the knee, then it's wandering around. So she was treated successfully with pulsatilla for 17 years by the other homeopaths, and they gave her increasing potencies up to 10 M. One thing I find is when I get patients from other homeopaths, often the problem is posology. Often the other homeopath got the remedy right, but they just didn't increase the posology. I find you have to keep increasing the posology until it stops working. You go up and it stops working, and then you got it. Then you know you have to find another remedy. They never did that. They went up to 10 M. They wouldn't go above 10 M. I find that can be a mistake. You have the right remedy, but you're just not increasing the posology. And now with we have a lot of the polycrest. We have 10 M, 50 M, CM, DM, MM, and then once you get to MM, we've started making the MM plus 1 hour plus 2 hour. Once you have that, you can stay on the same remedy indefinitely for years. I've had some people on the same remedy for years. She was controlled. They controlled both the rheumatoid arthritis and the allergies. And like I said, she had 3 previous homeopaths before her August 30th, 2023 visit. So we're going to digress and now talk about rheumatoid arthritis in the homeopathic treatment, and then we'll go back to our patient. What are the common symptoms of rheumatoid arthritis? Usually they're just symmetrical. That's how it differs from like gouty. Gouty is usually asymmetrical. Rheumatoid is usually symmetrical. And pain and swelling, especially the small joints in the fingers, toes, wrists, ankles. Morning stiffness, more than 30 minutes. Better with motion. So better with motion, not so careful. It's common, so you don't put too much weight on that in the repetirization. The joints are hot, red, and you get deformity. And this is a swan neck where you have hyperextension of the PIP and flexion of the DIP. I can't do it because I'm not hyperextensible. Maybe someone is. But you see the deformity here. Also, you get ulnar deviation. There will be the fingers will start deviating and then get deformed. And like I said, you can have constitutional symptoms: fatigue, weight loss, fever. Worse, cold, damp, very common. Better with warmth and movement. So you don't want to overemphasize those symptoms in your repetirization. They sometimes can be useful. Common rubrics: chronic articular rheumatism, you look under extremities, rheumatic, chronic. If it's deformed, you can look under extremities, inflammation, chronic, deforming. You have to be careful because these disease rubrics are always incomplete. If you have a remedy that really fits the case well, the characteristic symptoms, and it's not in one of these rubrics, you can still use it. And then if the patient cures, you can add it, or does well with it, you can add it to the rubric. So these disease rubrics have to be careful. They're never complete. But it's a place to start thinking of remedies. You have the type of joint pain, tearing, stitching, sprain, morning stiffness on rising. Of course, the classic remedy that has that is stiff in the morning, first movement, better continued movement, roost tox. But let me tell you, there's lots of remedies that have that picture. It's not just roost tox. There's probably 20, 30, 40, 50 remedies. Hecla lava has that. Many other remedies have that. Swelling of the joints, heat of the joints, redness of the joints, pain better with motion. And here's where we typically differentiate. Better during motion, you think of remedies like rust tox, and worse during motion. And usually the more inflamed it is, it'll be worse during motion. Then you think of remedies like bryonia, but there's others as well. For the arthritis, you want to take a complete symptom. For the history of present illness on the arthritis, you want to take a complete symptom. What is a complete symptom? You want to have all these elements. You want the etiology. What caused it? What are the concomitants? What else is coming with? Are they having sweats with the joint pain? Are they having fevers? Are they having chills? Are they having digestive issues? Modalities. What time is a big modality? And what makes it better? What makes it worse? Sensations, and then location extension. And then you also need to consider the rest of the history, past history, family history, social history. Maybe there's a history of gonorrhea in the family. Maybe consider metarhinum or some other history like that. I'm a big one for social history. Are they, smoking, drinking? How's their diet? You always want to change those things, be more anti-inflammatory with an inflammatory condition. Look at their immunization status, and is that contributing? Mental, emotional symptoms, and then physical exam. So some characteristic etiologies would be synovitis after injury. And of course, you think of arnica. Arnica is just worse movement, and hot or cold doesn't make a difference, and they don't want to be touched. We'll talk about it a little more in a second. Rheumatic fever. I had a patient once with rheumatic fever, did really well with, I believe, pulsatilla. It was after, I believe, after an MMR shot. Then they got a fever and swollen joints, and they had positive strep, and we gave pulsatilla, and the patient did really well. So fever with joints, you have to be careful there because, especially if they're strep, it can affect the heart. Concomitants. Again, the joint pain can alternate with heart symptoms. Then you think of remedies like aurum, calmia, ledum, have that conjunction. You have the arthritic nodosities. You think of remedies like calc fluor, benzoic acid, which has really stinky urine, calcarb, cracking in the joints, and in the patient, keloids. So you think of remedies that are good for keloids, fluoric acid, silica, etc. Modalities. After cold exposure, you have the classic rust tox case where the person is out camping and then it rains and then they're cold and wet in their tent and then they get arthritis. So you think of a remedy like rust tox. It's like they get chilled and they're wet and then they get arthritis. Motion ameliorates. We talked about that. Again, that's classic for rust tox. And then motion aggravates. Bryonia is worse. Also here under joints, motion aggravates, we have colchicum, which is colchicine, which is an allopathic medicine. That's one of the main remedies we use, Colchris, colchicine for acute gouty attacks. It works really well. It causes aplastic anemia occasionally, but it works really well for acute gout. Better with warmth. Especially if you have burning pain, better warmth, you think of arsenicum. That's characteristic. Better with cold, you think of remedies like pulsatilla, ledum, sakali. Worse in the cold weather, worse cold wets, you think of like dulcamara, calcarb. And joint pain at night, if they have joint pain at night, they're worse hot and cold and they're drooling. What remedy do you think of? Drooling at night? Mercurius, that's right. But there's other remedies too. Location extension, so small joints. Let's was going over a case yesterday with one of our practitioners, and we mentioned one of these remedies. Actia spicata is a remedy that has like wrist pain, and I believe the modalities are it's worse motion and worse pressure. So you think of a small remedy like that for small joints. Cauliflorin has small joints like fingers. Ledum as well, pulsatilla. A big one is wandering joint pain. I always think of pulsatilla. It's one of the main remedies, but you see there's others: lithium carb, calibic, aurum, arnica, ferrum phos. But you'll notice there's no rust tox. So if you have a patient with wandering joint pain, it's not rust tox. What's the direction? It goes down, you think of calmia, although calmia can also have going up. Then if you have joint pain like in the ankles or feet going up, you think of ledum. Ledum is also a great remedy for Lyme prevention. I use it pretty often for any kind of bites or tick bites or anything as a preventative. And some would say it works for like stages of Lyme. I have limited experience with that, a little bit. It's also good for puncture wounds. It's a great remedy. When people have a puncture wound, it's sore, you give them a few doses of ledum, and it often will get better. If they start getting into shooting pain, like more, they're getting a little bit maybe into that shooting pain, then you think more of hypericum. Sensations, aching, burning. Sempervivum is an interesting remedy. I have a patient who's taking that. He has a recurrent squamous cell carcinoma on his tongue. Doctor keeps going in and chipping off parts of his tongue, but we gave him, and recently he had a long time without, and then he stopped taking the remedy. It came back. So I said, go back on it. Feeling like dislocation, drawing, paralytic, pressing, shooting, causticum, sore. Of course, you think of arnica, like sprained, like ledum, arnica, rust tox, maybe ruta. Stitching, you think of remedies like the calis, calicarb, calibic. Hecla lavas, like that, really acute pains. Bryonia, tearing pain. So let's talk about a few remedies. Rust tox. I've underlined certain symptoms. These are the sine qua non symptoms. So if you've ever used a repertoire, you know when you repertorize, you end up with a list of symptoms from the patient. Okay, I have a list of symptoms. And then the repertory gives you a list of remedies, and then they cover to a different degree. Well, the way you do it is you put the genius in your computer, most characteristic symptoms, and then less and less and less. You have a list of symptoms of the patient, and then you have a list of remedies. And then what you have to do is say, okay, this is the patient's condition. Which of these remedies, the characteristics of that remedies also fits the patient? So that's what these sine qua non symptoms are. Like if rust tox comes up first, but the person has wandering pain, it's out. Rust tox is out. Can't give rust tox. If sulfur comes up first, but the patient's chilly and never uncovers their feet at night, sulfur's out. If calcarb comes up second or third, but the patient isn't sweating at night or sweating on their head or sweating easily, it's out. Okay, so that's what these sine qua non symptoms are. That's how you start going through the remedies and deciding which one could it be. Okay. So pain and stiffness on motion in the morning, better by continued motion. And the other thing about that is they're very restless at night. You really want to get the restlessness at night. They're turning, and they're better. They move a little bit, they're better, and they keep moving. These are the people, they wake up and their covers are everywhere. They're worse cold, damp. They're worse when they rest. So if they start moving, then when they get up, they're worse. It's a long sitting, worse change of weather. Better from warmth. If they're not better from warmth, it's likely not rust tox. Better hot baths, better gentle motion, better change of position. It's sprained, bruised, and again, red, hot joints, swollen. Some symptoms that you might have, but you don't have to have, but are useful if you do have, they crave milk. And I've seen it in patients with the flu with these kind of symptoms. They can have Or with rust poisoning. Rust tox is poison ivy. They can have a coating of their tongue, but there's like a little red, it's red at the tip, and it can be like a little triangular red. That can be a great symptom. There's only a few remedies that have that. Rust tox is the main one. Worse draft, worse wet when heated. That'd be like, you know, you were exercising and then it's got cold and rainy and you got chilled and wet. Here's a graph. Some of these I'll have graphs for. So worse rest, worse beginning of motion, better continued, better change of position, better warmth, worse cold, worse change of weather, worse windy, stiff in the morning, stiff in bed, likes milk, worse draft. And you notice wandering? Nothing. Not there for wandering. So if you have wandering, it's not rust tox. Getting wet when heated in the rain. They have an interesting thing. Rust tox has an interesting thing because it's like from overwork. They have dreams, exhausting dreams. They wake up in the morning and say, oh man, I dreamt so much, I'm tired. You think of rust tox for that. Better lying on something hard. That'd be like with back pain. They can have a map tongue and then the red tip of the tongue, the red triangular tip of the tongue. Causticum. Deforming arthritis, stiffness, contractures, weakness, paralysis. I use it a lot in people, especially with bladder paralysis, people who maybe MS and they have incontinence or something like that, or after delivery there's incontinence. You think of a remedy like causticum. Worse, cold, dry, better with warmth and damp, burning, raw in the joints. And to prescribe it for a chronic case, you really need, they're sympathetic. Other people suffering really affects them, and they're very sensitive to injustice. So that means the difference here is a lot of people are, you know, sensitive if something gets done to them, but these are people that, you know, they go in the world and they go to all these rallies and they're like really active. Like if they see other people are getting an injustice, if they go into action. Okay, so you think of causticum. And also, so you need that sensitivity to injustice. And I usually ask people to rate it. Well, how strong is your sensitivity to injustice? With a causticum, if it's really a causticum, they're going to say it's 8 out of 0 to 10, 8, 9, 10. We had a new patient with Dr. Stain on Wednesday, 5.5 hours. He took the case. And the patient said, how much is the sensitivity to injustice? 100 out of 10. So that, you know, you think of causticum, although causticum wasn't a remedy, but that's what you think of for causticum. They're also sensitive to drafts, and usually they have warts. The most characteristic feature about the warts is they can be around the nails on the fingers.
Oh, not on the face.
Can be, but you want warts. If the patient has no warts, it's hard to prescribe. Or ingrown toenails, I think, is another one. One or the other. Bryonia, again, worse from the slightest motion. These people want to be still, they don't want to move, and they want to be quiet. They're better from rest. Like if they move, the pain is an 8 or 9. If they're still, it's a 0, 1, like that. Better with pressure. Like if they have chest pain, they want the pressure, they want to lay on it. Hot, swollen, tense joints, stitching pain, so it's more like sharp pain, like pleuritic. We think of it for injuries to the ribs. With Asclepius tuberosa too, right? Injuries to the ribs, Asclepius tuberosa.
Oh, yeah, there was only 2. It was at the articulation
Yeah,
of the rib and
right.
the vertebra.
But there are other remedies for that, but you think of it for that. And again, it's always worse motion, worse breathing. They want to lie still, not be disturbed. They're irritable. They have a dry mouth, but they want to drink large quantities infrequently. Why? They don't want to move. So again, pleuritis you can have with this. Here you see they want to be quiet. Intolerant of any disturbance. They're better with rest, better with motion. They're not like a pulsatilla. They're more like an angry bear. You don't want to get near them. They're gonna. Worse motion of the affected part. slightest motion, better pressure, doesn't want to be carried, jarring is worse. They hold the area when they, like the chest when they cough or their head when they cough. They're better lying on the painful side. They're worse in the evening. They have a dry sensation of dryness with thirst for large quantities at intervals. And they tend to be more right-sided, but that's not so characteristic. Ledum, again, the pain goes upward, begins in the lower joints, ascends upward. It's a big one for gouty arthritis. Better from cold. Although you have to be careful here. Any really, really acute inflammation is going to be better cold in most patients. They're worse heat. And this is how actually arnica and ledum are very similar remedies. They're both like for injuries, but arnica is usually first stage and then ledum comes later. And you'll see maybe, oh, I'm better with cold. At first with arnica, they don't want anything on hot, cold, no, nothing. It's just motion is worse. They want to lie still. So better from cold, worse heat of the bed, worse motion. It says joints swollen, pale, a little red. I don't find that. Sometimes it cannot be cold and still you can use ledum. Cold, puffy, painful joints. Like I said, gouty arthritis. And gout, you think of people with alcohol, but can also be from injury. What's the #1 cause of gout now? Why do people's uric acids get high now? Drugs will cause it, absolutely. Certain drugs like diuretics, absolutely. What else? What in the diet? You know, everyone talks about purine meats because why do you form uric acid? Purine's like AMP, adenosine is a purine. If it doesn't get built back up in the ATP, you don't have phosphates to do that, it gets taken into uric acid, right? What else causes it? What's the main dietary source? So we all know that organ meats, but how many people eat organ meats? Not many. What's the main source of high uric acid now in the diet? Well, organ meats particularly. Fructose, high fructose corn syrup. It's very interesting. Fructose is metabolized. Glucose gets metabolized, every cell, head to toe, can metabolize glucose. When you take in fructose, it only gets metabolized in the liver. So what happens is if you drink high fructose corn syrup, you get a big, you know, you go to the Quickie Mart and you ask for a big slushie and it's all that high fructose corn syrup. What the liver does, it has to metabolize it, sticks a phosphate on it to metabolize it, and you use up all your phosphorus. So then you can't reform ATP. So the AMP, it gets body very quickly converts it into uric acid. So that's probably the main source in the diet. So watch out for fructose. Yeah, fructose, high fructose corn syrup. That's why that's so bad. And it's interesting, uric acid is a hibernation hormone. Bears, before they hibernate, they'll go and eat berries to get all the fructose they can. It raises your uric acid. It makes you gain weight, makes you get hypertension, hyperlipidemia, kidney stones, gout. But I mean, if you're a bear who's, you know, just gonna lay around for 3 months, that's good. You need that extra weight. But for humans, not so good. Calmia. This is a remedy I haven't used so often, but it's one to think of, especially if you have the heart involved. So you get sudden shooting pains moving downwards, upper to lower, so the opposite of ledum. And they're wandering, numb, stiff, and then heart symptoms with the rheumatism. Worse motion, sitting bent, cold winds. Better sitting and standing erect, lying on the back. There's another remedy. I always think of these two together. Calmia and spigelia. Spigelia usually has heart involvement, like valvular heart disease, but it has like a higher pulse. Calmia is like digitalis, has a very low, slow pulse. So you see here, and you see spigelia is all the way on the end here, and calmia is here. So left upper extremity pain with heart symptoms, extending to the left hand, cold, worse wet weather, metastasis to the heart, gout of the heart. going upward, but it can also have going down. You can have going up or down. More typically is down. Sudden pains appear and disappear suddenly. Worse motion, better rest, hot, red, swollen, and again, slow pulse, bradycardia, slow and irregular pulse. You think of, when you see something like that, you think of digitalis as well. For digitalis, it's usually you want to see maybe some nausea. Dr. Shepard, when he told me stories about being at Cook County Hospital, and when they would give digitalis to patients, they didn't have dig levels. So they would keep giving the digitalis. The person had a heart problem, they were heart failure or something, they'd give them IV digitalis until the person would start vomiting. So that's a sign of toxicity. So you really, to prescribe it, you want, digitalis, you want to see a slow heart rate and maybe some nausea. Arnica. Bruised, sore, worse from motion, worse from touch. And these are the patients, if you ever see someone in a car accident, they're bloody, there's glass everywhere, and you try and approach them and they're like, I'm fine, don't touch me. And they're obviously not fine. So the symptom is, there's a rubric in the repertory, fear of being approached, right? Or says that they're well when they're not.
Sends the physician away.
Yeah, sends the physician away, even though they're really in bad shape, because they just don't want to be touched, because to be touched would be painful. They have a history of trauma or overexertion, and it can relieve soreness after long exertion or injury, even a long time after, if you've never given it. Most of my patients, probably any of us have long-term patients, we tell them, look, you get an injury, take arnica. I have in my car, I have arnica and hypericum, just in case if you're in an accident or something, you start taking it right away. Arnica is a great remedy if you, like people always wonder, oh, should I go to the hospital or not? If you take arnica, a few doses and the pain goes away, it's probably not too serious. If you take arnica and it helps, but you have to keep taking it, then you might have a fracture. It's interesting, I have a colleague, he's a physiatrist, he just does pain medicine. He get all his patients on opiates. And he was with him once in our meditation center, and he had a fall and he broke a scapula. He was in tremendous pain. Of course, we called paramedics, but it takes them a while to get there. I started giving him arnica, 200D. I had a 200D right there. And he said, wow, it takes it away. He said, it takes the pain away, but it just doesn't last long. So we kept giving him every couple minutes, give him another dose, another dose. Then they took him to the hospital, they gave him morphine. And he told me later, he said, Tim, it was really interesting. The arnica took the pain away, but it just didn't last long. When I took the morphine, it didn't take the pain away. It just made me not care. Interesting. Calcarb, again, you want the sweating on slight exertion on the night, at night on the head and neck, at least a history of that in the past. And then you want the fears, heights, infections, they have lots of fears. Phosphorus and calcarb are the two main polycrests that have lots of fears. Without fears, it's hard to prescribe them. Phosphorus would be other fears like thunderstorms, things like that, blood. So chronic rheumatism, working in water, cold, wet weather. Dyspnea, just going up a slight incline. And then calc fluor. I think about it whenever a patient has scoliosis. If you look under scoliosis, one of the main remedies, it has a kind of a syphilitic bent, so there's a structural issue. Arthritic nodosities. Induration, it has hard. Those are what you think of for the hard, bony hard. You think of Hecla and you think of calc fluor, maybe fluoric acid. Worse cold weather, beginning of motion. It's better with warmth. If you look under better warmth, there's calc fluor, but not calcarb. Interesting. Better continued motion. And they often have teeth problems. They'll have deficient enamel, their teeth get brown, yellow, and premature caries. Of course, sulfur, you want to see the heat. The thing about sulfur, they're a warm-blooded remedy, but the characteristic thing is the heat is not equally distributed. They want to, at night, when they get hot, they want to cover their feet. I always know when I need to take sulfur because I have the window open, even in the dead of winter, and my feet will get hot, and I'll have to take my socks off and uncover my feet and stick them toward the cold window. So uncover the feet at night. You want to see that in the history. And the more frequent it is, so some people say, oh, it's only 1 foot. Okay, that's less intense. What you want to see is maybe 1 foot, both foot, 1, 2, 3, 4, 5 days a week. And then you ask for how long. They say, oh, just the last week. But they say, oh, my whole life since I was a kid. Then you have a rock solid symptom that you can, that you can hang your hat on, right? Worse heat of the bed, worse in the morning, worse standing. They tend to want to lean. I do that a lot. Better dry warmth, motion. They tend to be not so, they don't worry about their physical appearance and stuff. They're not like lycopodium. They want to dress just perfect and have everything perfect. They don't like to get wet. They're inquisitive, creative. I gave it a couple days ago. I had a patient who's an artist. Very interesting. He kind of came in and was kind of a little spacey and, really good artist and this and that. And so I ended up prescribing sulfur, but he smokes marijuana every day. He's like in his 40s. I'm like, and I said, why? Well, after I do it, I get more creative for 15 minutes. I'm like, go for a run, go for a jog, go work out, have a cup of coffee. You'll have some green tea. You'll get the same benefit without and that smoke is bad. There's a guy I grew up with, and he was very heavily into that. He died at 35 of a heart attack. It's bad on your lungs. It's bad on your heart. It's interesting. He said at the end, he said, oh, think about it. Maybe I've grown up enough. I don't need to do it anymore. It's like, okay. Offensive diarrhea, they tend to be offensive, and especially it wakes them and drives them out of bed like 5 a.m. Those are the ones who wake up and like, uh-oh, get to the toilet. And the odor is usually like rotten eggs. So uncover the feet, burning foot in bed, worse standing, they're stooped. Red lips, think of it in kids when you see red lips. Worse hunger, faint from hunger, they crave sweets, aversion to eggs, or they can say, I don't care about eggs, I can have them, not have them. They say, I really crave eggs. Probably not sulfur. Worse if they sleep too much, worse after vaccination, although that's not a good rubric. I know in veterinary medicine it's used more. In human medicine, any remedy can be used for ailments from vaccination. Eruptions in the margin of the hair, ailments from embarrassment. A classic symptom, but you don't really see it. They think the rags are beautiful. Fanatics, fanaticism. They fear of infectious disease. The artist patient, I think he had that a little bit of fear. He's afraid he has had some skin itching, and he's afraid he's passing it on to others. Fear of heights. Usually don't have too many fears. Unlike calcarb, which has a lot of fears. Sulfur, usually heights. They don't like heights. I usually ask, okay, they say, well, I can go to the Willis Tower, but I can't stand on the edge too long. Well, that's not really. What you want is the ladder, like how many rungs up the ladder. It's really strong if they say 1, 2 rungs, 3 rungs, maybe 4 rungs. Okay, then it's maybe a 2 underline. If it's 1 rung, maybe 3 underline. Indifference to external things, diarrhea, 5 a.m., sending them out of bed, the odor like rotten eggs, worse washing, scratching aggravates, they get a burning after. It's interesting, they're not sensitive too much, but the odor, like they can't use outhouses. They're sensitive to the odor stool. Don't ask a sulfur dad to change diapers. He's not going to want to do it. Give him another task to do. And they're usually worse 11 a.m. with the appetite. Usually they're hungry at 11 a.m. and their energy goes down around 2. There's a trio. Pulsatilla has the wandering pains, better for motion, and usually with pulsatilla, it's not violent motion like other remedies like Hecla and sepia. They're mild, they're weepy, irresolute, yielding. They have strong desire for fresh air. If you ask, well, how at night, how important is it to have the window open? They'll say 8, 9, 10 out of 10. They're warm-blooded, worse heat, hot room. They're better cold applications. They're worse motion. But no, they're better gentle motion. And usually they have low thirst. All you have to be careful there because they can be thirsty. And usually there's some menstrual issues or PMS. Silica, the characteristics are you look at the nails are brittle and they have white spots. They have caries, the teeth are not so good. And the big sine qua non is they have offensive perspiration. They tend to be more chilly, so the opposite of pulsatilla, worse cold. They're okay in a warm room. These are the people I think of several remedies. I think of arsenicum, I think of silica, and maybe Heparsol. They'll say, oh, if the room is really warm, everyone else, oh, this is too warm. Oh, I love it. But what about going in a sauna? Oh, that's great. That doesn't bother. Pulsatilla, you put them in a sauna, they're like, I ain't going in there. Forget it. Too hot. And then fluoricum acidum. Everything is worse with heat. Nothing is better with heat. Although they can be worse in the cold air. And they have caries and the nails are affected. And in our patient, it's the keloids that sometimes will make you think of it. All right, so let's go back to our case. Any questions about any of that before we move on to the case? Go back to the case. Any questions online?
Just,
Oh, we're good. We're good.
Okay.
okay.
Okay. Yeah.
Keloids are cicatrices. They're not called keloids. Or are they called?
Bob knows the official. There's two things. There's hypertrophic scars. I never saw her, so I'm not sure if it's a hypertrophic scar or a keloid. Apparently, a keloid goes. A hypertrophic scar is there's a scar and it just gets kind of big. Keloid goes beyond the boundaries of where it shows, something like that.
Yeah, cicatrix literally just means scar.
Yeah.
So cicatrices mean scars, plurally. And then, like you said, there's 3 types of scars. Regular, the one that gets bigger but doesn't go along.
It doesn't expand.
There's hypertrophic, and then there's keloid, which you get like a tiny scar and it expands way beyond the boundaries of the scar.
Okay. Did I answer it, Francine?
Yeah, I was looking in the repertoire for keloid.
Yeah, it's under skin. Or you might look under cicatrices, skin cicatrices, keloid.
By the way, can I just ask a quick question?
Yeah.
I don't know the answer to this. I was just.
Right, it's a question.
So I was just wondering in terms of keloids, if you match it really good, the person has a keloid, how often do you really see it improve it? Because in dermatology, I've never gotten a keloid or even a hypertrophic scar better with a remedy ever.
This patient, they improve.
Really?
Yeah.
How about I don't know, like, is that typical for when you treat patients? Because you got, or would you you get like 5 people like that in a year? With all of them?
I don't get 5 people like that in a year. You will, but I don't. Because I have a just general practice, but it's like anything else. If you, like this patient was a really good patient. She was really sticking by homeopathy for 21 years and did really well with arthritis. And she was getting the steroid shots, but when I told her stop the steroid shots, the keloids got worse, and then eventually got to the point where remedies like folic acid were helping, and it was getting better. So it's possible, but it takes time. You have to be patient. With skin things in general, you have to be patient. Everyone, because you see skin, so people are like, make this go away right now. It's like, I don't like that. It's
But
like
her keloids,
bringing something out. You gotta, it's like, if you want it to go away tomorrow, just take Dupixent. And
her
don't
keloids,
have to be when you get tuberculosis and cancer.
her keloids weren't a priority for the vital force either.
Right. So I mean, it's more superficial, right? So, all right. So this was her first visit, August 30th. These were her characteristic symptoms, kind of in a small nutshot. I took a complete history, but she had hot flatus, she had wandering joint pain, weepy easily, worse at 2 p.m., when you think of sulfur, but also pulsatilla has that. Headache, worse light of the sun. Headache, better after sleep. And she uncovers her foot at night. Good picture for pulsatilla. So I started her on pulsatilla, which she'd been on for like 19 years. I went back to 200C in water, and I told her to stop the steroid injections and the keloids. The last dose was after the first visit, August of 2023. When patients take your advice to heart, they can get better. Some patients will, no, I don't want to give up my allopathic. And then those patients, it's like, okay, well, that's going to be a barrier to maybe full healing. It's the patient's choice, really. But this patient had such good response to homeopathy, she decided to do that. Gradual improvement. By October of 2023, she was up to pulsatilla 50M. You notice August, September, within 2 months, I already went up to 50M. I didn't hesitate. That was higher than she had been before. And she wasn't taking a water dose. She was taking 1 pellet twice a day and as needed, sips. And then in September, we managed a UTI successfully with pulsatilla 10M to 50M. So that was 2023. By October, mid-October of 2023, the improvement plateaued, and she had new symptoms: offensive perspiration and sharp pain in the keloids, brittle nails. So what do you think of? Yeah, silica. So we switched to silica. So when there's a change in picture, you try a remedy and then you see how long you stay with it. That's how close of a choice it is, and that depends on how that determines how long you stay on it. So we switched to silica 200 in water on 1019. She got a strong aggravation, so we went down to 30C in water on 1027. It's interesting, students often ask, we had a student came from Puerto Rico last week, a naturopathic student. She's also a nurse. You met her, right? Desi. Yeah, she's nice. But she's, I don't know about posology, but it's like, posology is not the most important thing. The most important thing, posology works its way out. The most important thing is getting the right remedy, finding the symptom, what fits the patient the best, right? And then the posology, you give too strong, they'll aggravate, so you go down, put it in water. You don't see much reaction, go up, go up. They react and they get plateaued, go up, go up, go up. That's, posology has a way of working its way out. It's finding the right remedy, it's the hard part. Improved on the lower potency until April of 2024, which is, she was only on the pulsatilla up to 50M for 2 months. So she's on this one from October until April. That's like 6 months. That's pretty good. And it's interesting, in 19 years with the other homeopaths, I never thought to give her silica, but maybe she never had a silica picture. I don't know. Here's a repertorization from then. And you see the main thing is the cicatrices, stitching pain, silica. So keloid, better warmth, offensive perspiration, follows pulsatilla. It has wandering pain, not as strong as pulsatilla. Worse draft, worse cold air. She had dreams of dead people. So salt, ice water. It's interesting. Silica is a chilly remedy like phosphorus. It can be chilly, but they like ice cold drinks. We have to be careful with ice. You can just use cold drinks because in Hahnemann's time there was no ice. So the provings, there was not ice in the original proving. So just use cold. Sinuses, uncovering the foot, abscess. Then April 2024, the keloids and the allergies were worse. Why are the keloids worse, Bob?
I'm sorry, I didn't hear that.
Why are the keloids worse? What do we do on the first visit with her?
Oh,
Steroid shots.
so you stopped the steroid shots, so that's why she's doing it.
That's why. So you have to tell the patient. You will lose the patient if you don't tell the patient, look, I want you to get off your steroids. Your keloids will get worse before there's any chance of them getting better. So be prepared. And it could be for a long time.
And guess what they're doing now? Now they're injecting analog 10% steroid with 5-fluorouracil.
Wonderful.
So if you really want to suppress somebody, that's
Yeah.
what they're doing now.
Chemo. What gets me is the people that have dry eyes and they do the eye drops. I forget what they're called. No, the eye drops, the prescription eye drops, and their chemotherapy.
Cyclosporin is one.
Yeah, cyclosporin. What are they called? I forget the name of the drops. Yeah, they're like they irritate the eyes, so they cause tearing, but they're chemotherapy. It's like, whoa. I forget the name of the drops, but so the keloids and allergies are worse, but the RA is 25% better. At this point, I tried phosphorus, but she had tried it before, it didn't work, and guess what? This time it didn't work either. So I was like looking, I say, what's next? Then we switched to floric acid, 30C in water and 425. That was a good remedy. And you see here why the floric acid, you have keloids, especially stitching, painful, and raised and discolored. It's one of only 2 remedies. Sore, painful, become red, and worst beginning of motion, burning foot, she's uncovering the feet. Again, floric acid is very similar to sulfur. They uncover their feet at night. And the brittle fingernails. And see, worse cold air. So even though it's a really hot remedy, it can be worse cold air. With the floric acid, her joints were much better. No aggravation. With the other joints, the remedies, there was aggravation. With the silica, there was aggravation. Phosphorus, nothing. But no aggravation, just better. So I think this was maybe more closer to the simillimum. She takes 1 drop about once a week when the joint pain recurs. Next day, improvement, no aggravation. Energy has improved from 6 or 7 to 7 or 8 out of 10. Hair is no longer falling. Her alopecia, no, probably telogen effluvium, right? Her telogen effluvium is better. No DTIs, only 1 migraine. The RA is overall 70% better. Right, Bob? Telogen effluvium, probably, from the illness. Probably not alopecia. We call it alopecia.
Especially if it came like, 4 or 5 months, 3 or 4 months after her disease got bad.
So I told her, try taking, because you're not getting aggravation, try taking the floric acid daily for 3 days. And notice the sequence. She went from pulsatilla for 19 years, then silica for 6 months, and now floric acid, which she's tried now. She's been on over a year. Keloids were worsening off the steroids as the RA improves. Floric acid wasn't helping yet. That was June of last year. No, 2 years ago. October of 2024, she was up to floric acid 1 pellet. Now she's up to 1 pellet once or twice a day to once a week. The RA is 30 to 40% better. Allergies are 60 to 70% better. Migraines are 40 to 50% better. Keloids 60 to 70% better. Only 1 UTI. What? Oh no, the keloids are worse. Excuse me. Keloids are worse. That's right. They haven't improved yet. So it's been a year already. When did we start on the? Yeah, so it's been a year, a little over a year. She stopped the steroids, and it's still aggravating. Now you know why I don't like steroids. Because you're kicking the can down the road. You have to pay the piper down the road with interest. That's what happens with steroids. Doctors love to use them in urgent care. They love steroids. In the ER, they love steroids. And sure, if you have to save someone's life, you use them. But what you're doing is you're kicking the can down the road, and then at some point it's going to come to roost. You got to pay the piper. Okay. Then things kind of took a turn at the end of 2024. Her daughter was locked out of her business in New York. A lot of tears, sighing. So I gave her Ignatia. 1 pellet as needed, up to once or twice a day. And the Ignatia helped the joints. So now she switched to Ignatia because of the stress of having to deal with her daughter. She lives in Texas, and she's flying up to New York to help her daughter. Floric acid wasn't helping. March of 25, now she was up to Ignatia 200. 1 by mouth helps calm the RA. And floric acid, she's taking when the keloids flare. And now it's helping. It's been more than a year. It's been about 1.5 years, and now finally it's helping. It's not helping the joints, but it's helping the keloids. The RA is about 70% better, and the keloids are about 70% better. So finally, it took 1.5 years. them to improve. So you have to tell patients this is what's possible. Allergies and migraines are good. Then in April, she went up to Ignatia 1M, but she flared with the RA and Kilo, so you went back down to 200 in June of 25, 1 teaspoon every 4 to 7 days, slight joint flares. Then she's better for 4 to 6 days. UTI better with belladonna, then some napmir for some clear mucus with the cold. By October of 2025, she was on Ignatia 200, 1 teaspoon every 5 to 7 days. Mood was good, headaches gone, UTI's gone. The wandering joint pain is worse cold wet, worse cold bathing. These are more common symptoms. And the keloids better with fluoric acid, but the joints get worse with the fluoric acid. I switched here to calcarb because worse cold wet, which is a common symptom, but I didn't hear from the patient after that. I told her to take calcarb 1 pellet by mouth as needed and watch her flare, and then keep taking the fluoric acid for the keloids because that was helping. Like I said, the keloids were like 70% better. I didn't hear from her, and then I wanted to present this. So in February, I shot her an email, and this was her response. So I last contacted her, what was it, October of 2025, and she said she's holding up okay, but in the interim, what happened is her father died. He got sick. She was taking care of him, and then he died. And then she's been managing his estate and dealing with the loss. And she's been doing fine, though, with managing the RA with the Ignatia 200 once weekly. And she felt like that stress was part of the reason why the RA would go up and down. She said now she doesn't have any lows with the RA. It's just better, maybe better. I sent her another email back, what happened with the calcarb? No response. So I don't know, maybe she didn't take it or whatever, but she seems to be doing good on the just Ignatia.
She's no longer doing the fluoric acid.
I don't know. My preference would be she should, if it's helping the kilos, because I think the kilos were 70% better. They could maybe keep improving. I don't know if they'll go away. I mean, they're not curable in allopathic, right? Once you have them, they have to cut them out, and then it's surgical, and then they just come back, right?
Sometimes yes, sometimes no. I mean,
Well, they do surgery and then they inject something, right? So it's less likely.
I mean, occasionally, you know, they cut them out and they don't even come back even without any other treatment. But usually they cut them out, especially, you know, really big ones like the size of like, you know, bigger than like a quarter. Sometimes you get injection, nothing happens. You gotta cut them out, or the plastic surgeons cut them out. But then they sometimes prophylactically start injecting it, you know, so it doesn't come back. One of the guys I work with on Mondays, he's a big proponent of putting a 5-fluorouracil in the steroid shot, and it really works. Now, the only thing is we haven't really, you know, we only see them if it's flaring up, so I can't really tell you how many stay away completely and how many don't. But it sure would be nice if you could get the right remedy and cure them. That would be wonderful.
You know, it's interesting. We play with these chemotherapeutic drugs like 5-FU. They put that on the skin when people have, you know, actinic keratoses and such. They do those, you know, kind of peels with that stuff. But it's 5-fluorouracil. It's a fluoridated base that's used in DNA. It's like, it's a chemotherapeutic agent. It's going to cause cancer. I mean, its side effect is cancer, right? Every chemotherapeutic agent can be used to treat cancer, and in the long run, it can cause cancer, right? I mean, that's the side effect. But we don't, because that's long-term, we generally in conventional medicine, we go for short-term outcomes. You know, it's like, oh, we can make it better this week. And what's going to happen in 5 years? Well, I'll be retired then. It's not my problem. I think in homeopathy, we treat people for the long run. We want to make them healthy. I think that's what the patient wants, to be healthy in the long run as much as you can, have a good health span and lifespan, right? But in allopathic medicine, we don't think that way so much.
So Tim, for your case here, that's very impressive. She's doing really well with the rheumatoid arthritis, so congratulations. So the question is, how long has she been completely off of allopathic conventional arthritis treatment?
Since 2005 when she started homeopathy, so 21 years.
That's like amazing.
And you could say, and actually at first I thought, well, because she didn't have swelling, maybe her prognosis was better. But actually, oh yeah, you want that. Actually, the prognosis is not necessarily better with people that don't have swelling, because like I said, those people respond better to biologics and stuff because there's tissue inflammation, there's synovitis that, you know, that can go down with the biologics. But if you don't have that, it's like, it's the pain can be, it won't change with the biologics necessarily. And sometimes they say maybe it's centrally mediated or something. So yeah. Yeah,
Do you
no.
think the lack of swelling, Tim, is because of the lack of, I mean, it's a little contradictory, you know, the lack of the body's ability to mount a reaction, just like the, you know, quote, perfectly healthy kid who never gets a fever and never gets sick and whatever.
It could be. It could be.
But-
I think it's a different form of the disease, maybe. And the prognosis is not, I thought it would be better, but it's not necessarily better. Yeah, it's just a different, you know, in homeopathy, we treat it, every patient has a different disease.
Totally.
They have their own unique disease. And so they're going to have manifestations that are different from other people with that same disease. And, you know, in conventional medicine, the importance is to put everyone in the same box and then treat everyone the same. I call it industrial medicine. You put 100 people in the box, you treat them all the same.
That's
So,
that's what I was going to suggest. Like maybe she had a collection of symptoms that the allopath stuck the RA label on it, but it really doesn't matter until we're, you know, trying
well,
to.
she did have the positive rheumatoid factor, so that's one.
That's
And sometimes you don't see the swelling. You have to do an MRI or an ultrasound. I don't know if she had that done. Sometimes it's only visible on imaging. You can see the synovitis on imaging, but you might not see it just with your eyes.
Yeah.
So I don't know.
Yeah, it's interesting that she had the lack of exuberance in the joints and the synovial fluid and that sort of stuff, and
But not the skin.
and the relatively exceptional exuberance in the keloid. Although, you know, every time she was injected, the backlash from the injection would have been make more, right?
Right.
Yeah.
So yeah, maybe she was putting that inflammation into the skin with the keloids, and that protected the joints. I don't know. It's an interesting
It's a
thought.
lot of
But
moving parts.
dermatologists and rheumatologists don't often cross paths, so they probably don't even discuss stuff like that. Only homeopaths do.
I think this is a great presentation, and you said you're taking it to the joint meeting?
Nope. HAMP and then boron presentation.
HANP. Yeah. So lovely.
So summary, longstanding RA, 24 years, managed homeopathically for 19, 4 major remedies, pulsatilla for 19 years, then silica for 6 months, and then floric acid the last couple of years, and then ignatia. 70% overall improvement in joint, and last time we talked in the keloids as well. And then her other problems got better too. I mean, that shows the depth of homeopathic prescribing. It's like the whole patient gets better, not just, and Bob's always presenting cases like that, you know, the skin got better, but then the sleep got better, the bowels got better, the person's mood got better. You know, it's like, that's what we expect to see with homeopathy. In conventional medicine, if you ask about that, they look at you like, huh? I'm just looking at the skin, nothing else matters. But to the patient, it matters. We have Rockefeller to blame. He gave all the money to developing drugs for conventional medicine because they knew they could make billions of dollars. It was a great investment. And so that skewed the whole medical system toward that approach and reductionistic approach. But we're not reductionistic, materialistic beings. We're we have a energy, a force, a vitality, and a spirit, a soul that it's much in mind. It's much more complex than conventional medicine gives us credit for. But they're making lots of money, so they're happy with what they're doing, which is okay. If that's your goal in life, they're doing good. Not our goal.
So that's a great example of the pulsatilla silica floric acid triangle. So how commonly have you ever seen that? Is it like your only case that's ever had that triangle? Is it something you might see every 5 years or?
Well, I haven't prescribed floric acid till recently, so this is the first case I can think of. But It's because what happens when you learn a new remedy, you realize you've been missing that remedy. I've been prescribing sulfur a lot of times. Look at little Zane that you know, that you treated his brother and everything. I was giving him sulfur, and he's still on hydrofluoric acid 30C. Now he's taking pellets by mouth. He's losing his sensitivity. And his skin he's got a little patch here and a little patch there. I mean, so we're all learning. That's why they call it practice. Anyone who says, I've mastered homeopathy, I don't have to learn anything else, shake their hand and get out of there as quick as you can, because they're not being genuine, or they don't realize what they don't know. We're always learning.
On one of the Synergy series lectures that they were doing the case presentations, and somebody was talking about Rajan Shankaran, who said, if you fall in love with homeopathy, keep falling. It's a bottomless pit.
Yeah, no, it's true. And why is it? It's because it's a study of nature. I mean, we're studying medicinal substances, which can be derived from anything, and then doing provings, and then looking at sick people and trying to match. I mean, it's like the possibilities are limitless. I mean, truly limitless. I mean, how many symptoms can you have? It's like I don't know there's any limit. I mean, it's not a week goes by, a patient won't tell you a symptom that you've never heard before. Some weird thing, and be like, huh, okay. Yeah.
Tim, did you say that calcarb is sleepy after vaccination?
No, I didn't say that.
Oh, okay.
I said under
mean,
theology, I said after vaccination, and you think of remedies, sulfur and other remedies. Sulfur and thuya are the classical ones, and silica in veterinary medicine. But in homeopathy, we don't use that rubric much. I don't ever use it, because I found that kids who are vaccine injured are really brain damaged. They had encephalopathy. It's interesting what happened. The history is, in the 80s, so many kids were getting encephalopathy from the DPT shot that every dollar that they earned on the DPT shot, they had $20 in downstream liability to pay off the lawsuits, because these kids were brain damaged and like in a wheelchair, like for the rest of their lives. I saw one of those kids, and we totally missed the fact that it was a vaccine injury when I was resident, because we were like, well, vaccines are safe and effective. They don't cause any side effects. That's what I believed at the time. But if you don't have it in your brain, you can't see it in the world, right? But what they did was they changed the picture. They got Reagan to agree and the Congress to pass a bill to give them liability protection. And then the labeling changed. They don't talk about encephalopathy anymore. They talk about autism. And then they changed the whole research agenda. When they got liability protection, they said, guess what? We're not going to do any safety studies. So then they say, they're safe. They're safe. Well, how do you know? Because they're safe. There's no studies showing they're harmful. Yeah, because you won't do the studies. If you publish a study, even going in that direction, you get canceled. So it's not that there's evidence that it's a lack of evidence, and they're using that to say it's safe. Well, a lack of evidence is not evidence of no harm. You actually have to do the study. So and they changed the labeling. Oh, it's autism. Well, yeah, there's no study of autism and vaccines, because no one studies that. Because any researcher, they know if you study that, you will get canceled. You will get canceled. None of your friends will call you anymore. You won't get any money. You're going to be homeless on the street. And what? And a leper. Yeah, exactly. I don't know. I probably shouldn't say such things, but I've gotten to an age that I feel like, and I'm not the only one saying it. It's interesting. Is all this stuff since COVID, I think a lot of people's eyes have been opened that, we have to look at these things. Everything, there's nothing that's a free lunch. You always have to pay at some point, And some of these, I'm not saying these things are all bad either. There's pluses and minuses, but people should have a choice. Sure, people shouldn't be mandated to do these things. I don't think that's right. And I don't think these companies should have liability protection. I think that's wrong. Because you're just, I mean, just think if the auto manufacturers, if Detroit went and lobbied Congress, oh, we're losing too much money on accidents and people dying in car accidents and burning up because they're what's that one car that you hit the back of it and it bursts into flames? The
Corvair.
or
No, the Gremlin used to.
Gremlin, whatever. If instead of fixing the problem, they went to Congress and said, oh, we're spending too much on liability. Give us carte blanche so that we can't get sued. You know, cars would be bursting into flames every day. You know, your car would be sitting in the parking lot on a hot day and it just bursts into flames. You go, well, can't sue the company. Yeah.
That's your lithium battery in the electric cars that do that.
That's right. It used to be the computers, the Macs, they had problems when they first started doing the lithium batteries. They burst into flames. And to put out a lithium fire, it has to burn itself out. There's not much you can do. Yeah. When I first got a Prius, my wife got to drive it, and then she got in an accident driving it, and it wasn't her fault. And so we called 911, and they're like, well, okay, a little fender bender. And I said, but there's liquid coming out from under the car, and it's a hybrid. The cops were there in 2 minutes because they thought there could be a fire, you know, and then that doesn't look good. People get injured, people die in fires. Yeah, so yeah. But it was nothing. It was just a radiator. Any other questions?
There's a hand raised out there, but I don't know who it is because I can't see. I don't have access to seeing, but somebody's got their hand up.
That was me. I just have one comment about the skin. A lot of people forget that it's an excretory organ. So
Exactly.
vital force is using it all it can to push out whatever it can, and it shows up like keloids and atopic dermatitis and whatever else is going on. But
Absolutely.
things are trying to come out.
I had a patient, a little kid, the kid had perfect skin. And then he got one of these shots. He'd had several shots, but then they decided, we're going to give you this really super duper shot. It has 7 different antigens in it. And the drug rep came in here and they said, it's such a good thing. And so we gave it to this kid, and the kid immediately broke out in this horrible rash. And he had little flecks, like little gray flecks. And I did a little research, and that shot was known to cause a lot of side effects because it had so much aluminum. I think the aluminum nanoparticles were getting excreted.
He blew it out, yeah.
And I know in arsenic poisoning, when people get arsenic poisoning, if you don't die, you get a really bad rash and then if you scrape the rash and examine it, you have, there's arsenic in the skin. So it's an excretory organ. You know, if you get anesthetic gas, you're going to breathe out the gas. That's how you excrete it. If you take something that's water soluble, you're going to pee it out. If you something that stays in your bowels, you're going to poop it out. But if something gets in your body and it can't get out any of those realms, and you can't sweat it out like heavy metals, how are you going to get rid of it? Through the skin. It's an excretory organ, and when we interfere with that, we do it at our own, at our own risk. And we might win one battle with the skin, but we may lose the war with the overall health of the patient. The overall health of the patient may go down. I had a patient once who she was a flight attendant, and she had a rash. No, she came in. She was very depressed, and we gave her pulsatilla, and she first time in her 20 years she was much better with her mood, but she broke out in a rash in the back of her neck. And she couldn't tolerate it, so she just stopped taking the remedy. So she'd rather be depressed than have a rash. But it's like, why would it show up there? It's almost like there was some toxins in the brain that needed to come out, and it came out on the skin. The body has a wisdom that we don't understand. And when we go in there with our strong medications, with homeopathy, I think we're helping the body. When we go in with strong medications, we're creating more problems. It's like going to war in somewhere in the Middle East, and you think you have it all solved, and you end up creating 10 new problems. Not to tie it to recent events in history, but. Any other questions?
I see nothing out here. I still have one raised hand up, but
I'm gonna stop sharing. Oh, okay. And Jody, I think you're next, right? I think Jody's next. She did the hands up. All right, see you. Elizabeth, I see you have a question. You want to raise your hand? Ah, you don't. Okay. Jody. Jody, you have a hand up. How do I make you a presenter? Jeff, Susan, what do I need to do to make Jody?
I'm looking and I'm not sure that I can. I'm not sure that I have access to that because I'm not an organizer.
Yeah, if you click on her name, it doesn't say make her a presenter.
Ask to unmute. Someone say ask to unmute. Jody, can you unmute yourself?
Now I'm unmuted. Can you hear me?
All right.
Yeah, I can hear you. Okay, so
it says I need to be made a presenter to be allowed to camera share, just screen share, I mean.
You should be able to do that on the list of people. No, you can't, Jody. The organizers will have to do that. And I think remembering from menu as an organizer, you should be able to select her name and then make her a presenter, just like Jeff
make
said.
presenter. Okay, here we go. Make presenter. Okay. Why don't you turn on your camera too so we can see you? I'm going to turn my camera off.
Okay, just a sec. I have to do something, but like to record this computer screen and audio. So I have to open system settings. Sorry, it looks like there's a lot of stuff to do. Oh no, it says I have to quit and reopen.
Be here.
Okay, I'll try again.
Okay, I have to make a presenter again when she comes back on.
Is this tangential while we're waiting for the electronic stuff to catch up? But I had some conversation with Ed Condrado a while ago after he presented to this group, and we were talking about cataracts and this and that and the other thing. And he has a product that he uses that, he's clear to say it's not a homeopathy product, but it's a topical antioxidant. It's got acetylcarnosine and glutathione and cysteine and taurine and some ascorbic acid and stuff in it. And he uses it topically for a bunch of different situations. He's had it slow the progress of cataracts and regress stuff. He's had some really nice results with dry eye stuff and also, quote, seasonal allergies and that sort of thing. And then I've had a couple of cases that I have used it on when we're trying to convince the client not to use cyclosporin and other bad things. And one in a dog with some retinal hypoplasia who got snow blinded this year, and also in some humans that they're finding it makes a really big difference with their tiredness in their eyes, screen eye, too much computer time and allergy time and stuff. Anyway, it's there. I put the link to it in the.
Is that the Optimed?
It's called Oclumed,
Oclumed, yeah.
OCLUMED. Yeah. And I don't have any dog in the fight, but it's just a kind of cool product.
Yeah, it's expensive. It's about 40, 50 bucks. But I think it's interesting. It's one of the few natural eye products that wasn't taken off the market when the FDA did their thing with eye products.
Well, yeah,
The drops were taken off the market.
yeah, because it's a topical antioxidant.
Right.
Yeah, and it's I'm just looking at the price. The triple pack is $75 if you do a subscription on it.
That's not bad. So 25.
Yeah, so
Remember
one
being
like
35,
80,
40.
yeah, $85 for 3 packs, which is a month's worth. A vial a month is what I'm trying to say. So it's and what the heck? I mean, if it's going to help your cataract progression, or it's going to keep you off cyclosporin or tacrolimus or whatever your favorite one is.
Oh, I thought of the name of that drug. Yeah, Restasis. It's called Restasis, the cyclosporine eye drops. Yeah. I'm always shocked when patients are on it because they say, well, the doctor told me it's not steroid. I'm like, yeah, it's not steroid, but it's chemotherapy. It's what they use for people that have organ transplants.
Or they're happy to be on chemotherapy because it's not a steroid. I get that too.
That's how they market it. So
there you go, Jody.
Are you able to see my screen?
Yes, we can.
Oh, excellent. Oh, great.
We see you, Jody. And which is a way we can make it bigger?
It's not active for us.
You see it?
I see it, but that's where you would make it bigger on the right there. That's an active link for us. You click that, it'll get bigger, the plus.
The plus sign? Okay. I'm clicking the plus sign. Ooh, that might be too big.
Scary. Tell me when you're ready, because all I can see is my screen. So I see. Oh, there it is. Okay.
That's a little too big.
Do you want her pictures still on?
Do you want me to take my camera off, and then there'll be more room for the screen?
Try that. Yeah.
You can hide everyone by going to the top, active cameras. There's the top, active cameras in the middle.
How's that?
I'm going to see if I can. It doesn't go up though.
Active cameras, turn it off, hide it.
Okay, that's better.
You good?
That's too much. Okay, Bob, you want to introduce?
And presenter view won't work.
Is it working?
Jody, are you in presenter view?
Oh, well, all I'm doing is sharing.
Yeah, now I
It
have
just
to
says
go back
sharing.
to
You want me to do optimize for video? That's the only other thing that says that I could.
go back to your keynote and click on presenter view or play at the top.
Oh yeah, I can do play. How's that? Is that better?
Yeah.
Looks good.
Okay, cool. That's great. Do you want me to go ahead and start?
So without further ado, I'd like to introduce our next speaker, Dr. Jody Bierman. And of course, she's going to be speaking in a couple of minutes. I just found out yesterday that Jody is a very multi-talented person. She was actually a music major when she was in her pre-vet years, and she used to play oboe, which is probably the most difficult reed instrument around because it's a double reed instrument. So my hat's off to you for that. And of course, plays piano too, so that's good. So, but I'm really interested in what Jody has to talk about today. She'll be talking about 2 cat households because she's a veterinarian, and also she does human homeopathy. And she's going to be speaking about an unusual remedy which has helped 2 people with hidradenitis suppurativa, which is very important for a dermatological practice. So, without further ado, Let's give a warm welcome to Dr. Jody Beer.
Oh, thank you. I'm excited to talk to you guys, especially after Tim's talk, because a lot of the things he said kind of apply to what I'm talking to you about today. Although I didn't go in as much detail about repertorizations or anything, I'm kind of doing more of a general overview. I am a certified classical homeopath, which is a little bit different. It's for lay people, even though I'm not a lay person. There was an MD in my class too, and nurses and physical therapists and everything. But we do things maybe slightly differently in the way that we originally look at the person when we're doing people. So, I mean, obviously we use all the Hahnemannian classical homeopathy, but there's a little bit, so a few little different things, and that's kind of more what I'm talking about today. So without further ado, 2 cat households, aren't they adorable? They are my cats. So of course they are adorable. All my patients are adorable. I love every single one of them. So, and I'm sure all of us vets feel the same way. So Jimmy is the white cat, not the Chihuahua, but of course he has his feet on the Chihuahua. He's the first cat I'm going to talk about. I did give a talk about Kelly Carb at one point. I don't know if I did it with this group or not. And he did get Kelly Carb for a while, but he's a phosphorus. Anyway, he was a feral kitten found in the street. His family was all dead and he was horribly sick. I didn't know him at the time, but he was kept at a vet clinic for 3 months due to pneumonia and upper respiratory infections that just wouldn't resolve. And then after I got him, he aspirated a little amount of laundry detergent, which spilled on the floor. We no longer use liquid laundry detergent. This was quite a long time ago. Now we use those little pellets from Blue Land, you know, that don't have any plastic in them. But it led to a wet and dry cough and asthma. So he is an asthmatic guy. And there he is showing the Chihuahua that he can touch him. He's very outgoing. Like, we'll have workers come to the house. Like we had to have somebody come and do some electrical stuff that was having a problem. And they come in and he's like right there at the door. Hello, hello, what are you doing? Anybody comes over, he's right there. He's not afraid of them. He's always right there. He has a serious lack of vital heat. I will show you a picture later that shows it. He goes into the burners of the stove. When we had that particular stove, when we were cleaning the burners, he went into them because he could never be warm enough. He's not afraid of other animals. He's not afraid of dogs. He's not afraid of cats. He was a little nervous when we got the second cat, but we've had multiple dogs and we've had multiple dogs in the house. He doesn't care. He's like, hello. And if like the Chihuahua used to go after him, that Chihuahua has since passed, but he lived to be very, very old. And he would just swat him if he went after him. He'd just stand there and like, nope, no, very, very confident. And when he plays, he's very serious. Like if he finds a mouse in the house, which has happened, he will just kill it. He doesn't play. He just kills it. When he plays, it's like, I'm just going to kill you. And then that's that. He is extraordinarily grateful, which I find to be a really interesting quality. If I feed him, if he asks me to give him some food at a certain time and I give it to him and tell him how much I love him, he'll finish eating and then he goes and finds a toy and cries to bring it to me, just like a mom cat would bring to a baby. You brought me food, I will bring you food. I'm taking care of you. And he really does. He's very caring. He is my heart. I adore the heck out of this cat. Is he an Easter rabbit or a chicken? He sits in everything. This is what cats do. Okay, so if you don't have cats, it is normal for cats to try to fit into anything. Sometimes we say they don't have bones or they're made out of liquid. But some other physical problems that he had along with his asthma was foul feces, really foul. It was so bad. His litter box is in the basement and I would be on the second floor and it would wake me up because it smelled like something died in the walls. Real bad. He had been vomiting frequently and sometimes there was blood. He's on raw food, so I had to differentiate. Is it just that the meat looked bloody? But no, there was actually blood. and he easily loses weight. It's very hard for him to keep weight on. He had a lot of different remedies over the years because I'm really dumb when it comes to my own animals, and I'm too emotional, and I couldn't figure it out. And finally, I'm like, oh my gosh, duh, phosphorus, when he just couldn't keep any weight on. I was really worried. And actually, it was because one of my kids said, you need to lose or to gain weight, because I don't want him to die before Theo, the other cat, because what would Theo do without him? So I'm like, okay, that's it. I've got to figure this out. So he's been on phosphorus 30C now for, more than a year. And he's put weight back on, and he's feeling very, very good. He is excellent. He is doing so well. He does cough, maybe one tiny cough, maybe once a month at this point. And I'm not worried because he's put on so much weight. He's not anywhere near fat, but he's not a body condition score of 2 out of 10 anymore, which he probably did get down to at some point. I would say he's probably a 4, edging on 5. So I don't know if you have this in humans, but in animals, we have body condition scoring out of 9. I actually was at a neighbor's house this morning, and she wanted me to talk to her about her dog's poop. And it wasn't an appointment. I was just stopping by. And I said, well, she could lose a little weight, and because maybe she's a little too fat. And I didn't want to tell her, and her vet had never told her that the dog was fat, but that dog was an 8 out of 9. I mean, it's kind of like a tick that's almost full. So pretty bad. Yeah. Cuddles up to the stove. I was saying that phosphorus can be really, really cold, and we kind of forget about that. We kind of think that I don't always think that about phosphorus. You think about the really cold remedies, and Tim mentioned some really cold remedies, Hepar, silica. I can't remember what the other one was that you said, Tim, but I'm sorry.
Arsenicum.
Arsenicum, duh, of course, arsenicum can be really cold, but phosphorus can also. And I often use the complete 2024 repertory, which is huge. It's absolutely enormous. And under lack of vital heat, under generalities, there's like 700 and some or something like that. But you always look at the higher graded ones too. So they can be very cold. Just don't forget about that. But the big thing with cats is they're very outgoing. Those phosphorus cats are like, hello, I have no boundaries. I'm going to get right into your space, and I'm going to be right where you are, and I'm not afraid. Are they afraid of some things? Yes, they can be afraid of noises. They might be really bothered by changes of the weather. That might be harder to see in some cats, because lots of cats are cold and want to be in their little warm cat beds, and especially if we live in cold places. And he loves his little heated cat bed, but the more he's had phosphorus, and I don't give it very often, he only gets it every several months, as needed if he's not doing as well, especially if he's seeming really depressed and hasn't been eating well, especially if it's been for more than a couple days. I'm not quick to jump on it too soon, because he can aggravate pretty easily. And phosphorus is super sensitive, so they can. So just don't forget about that. They're really, really sensitive beings. They have no boundaries. Those super friendly cats often are phosphorus. And there's his little brother, Theo. This is when we first got Theo. He's Jimmy's little brother. He was also found in the street. And I got him through a feral cat organization that I do some work for. And the same youngest child wanted me is like, you need to get this cat. We need this cat. And he came to me with a pretty significant upper respiratory infection and a left eye corneal pterygium. If you look up pterygium, it's in the homeopathic dictionary. Well, Yasgur, do you guys use Yasgur's dictionary? Jay Yasgur is like the nicest guy, but he has this fantastic homeopathic dictionary. You can look up stuff for these old terms. And in this picture, you can't see it as well, but it's like a white, not just a film, it's like a white tissue over his eye. This wasn't the best picture, just happened to be one I had. But it's almost like a tissue over the eye. It is a tissue. And he was fearful of almost everything except Jimmy. He's like, protect me, Jimmy. Help me, Jimmy. And he did have an occasional cough when we got him. And he's very playful in a cute way. Like unlike Jimmy, who just goes and kills things and then I'm done and here you go and here's your dead mouse. And if you don't take it, I guess I'll eat it, but I'll leave it for you. Like actual mice, when we have had them in the house. Theo wants to play all the time, and he wants to play in this like really cute way with his mouth wide open and rolling around and stuff. It's really super adorable, but he'll only do that mostly with me. Well, these days he will with just about anybody, but at first it was really just with me because I was the only one he trusted. And he would play with Jimmy too. Another thing, a thing that led me to Theo's remedy, and I did go through a few remedies. I'm sure I started with euphrasia. I thought, oh, that's just a euphrasia eye thing. No, wrong. Did a few other remedies, but my husband kept saying he always sits so perfectly. He's always perfectly straight, and his little paws are perfectly lined up. He always looks so perfect. Everything looked perfect except his eye. He did start to get a little tremor when I gave him the wrong remedy, some wrong remedy, a little bit of a head tremor. And he always looks perfect. His weight is always exactly the same. His coat is beautiful and nice. He goes to Jimmy to have his head cleaned. He'll stick his head right in Jimmy's face and Jimmy cleans his head for him. He is so fastidious. So cats are fastidious as beings. They have to clean themselves. I mean, old cats might not be because maybe their teeth are icky, maybe they have kidney failure, things that go on when they get older. But cats generally are very fastidious because they are predators and prey, and you have to be clean so nobody can smell you or see you, right? When you're both predator and prey. So they tend to be quite fastidious, but Theo is extraordinarily fastidious. Whenever he sits, his paws are lined up perfectly. His coat is perfect. His weight is always exactly the same. He's so soft. So this helped point to arsenicum for Theo eventually. And with the arsenicum, he hasn't coughed in, I don't know, ever since he's gotten it, probably. He did have some occasional vomiting. Vomiting is not normal in cats. Even though everyone's like, oh, that's normal. No, it's really not. it's really not normal to have vomiting. I mean, if you're on bad food, which these guys aren't, dry food is really hard on them and will make them vomit a lot more. It's really bad for their kidneys. So they really do need canned or raw or something like that, not just at least not dry food. And he would vomit occasionally. Sometimes he wouldn't eat. It tended to be more. So this is interesting. I remember a homeopath years ago, a veterinary homeopath years ago, told me, oh, phosphorus is the one that wants to be petted all the time before they will eat. Actually, I find that more with arsenicum, because arsenicum also needs a lot of reassurance. They need to know that they're safe with you. So they don't want to be petted by just anybody. No, 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 no. That's too scary. But I need to pet Theo before he'll eat. I need to pet him for a little bit, and then he's ready to eat, and then he eats, and then I have to leave him alone. So they're not necessarily ameliorated by company or petting, but they just need it to be able to do what they need to do, just to know that they're safe. All cats kind of need to know that they're safe, but arsenicum really needs to know that they're safe. And one of the ways that Theo knows that he's safe is he cuddles up to Jimmy, who takes care of him. Because phosphorus is, like a lot of other remedies that we can think of, is caring, is very caring, because there are no boundaries. They feel what you feel. I think Tim was talking about causticum. Causticum is very caring, but they have boundaries for sure. Sulfur is actually a very caring remedy. I know we think of it as like, kind of the things that Tim was mentioning, but they're also very caring, and they can also be fastidious too, which is kind of the polar state to the ragged philosopher state, right? I know I'm not talking about that one now, but I'm thinking about it as we're going here. I'm sure I probably gave Jimmy sulfur at some point wrongly, but my poor cats, they've had to go through a lot with me as their person. And so they're a great combination. And arsenicum and phosphorus, I do see in other two cat households. It can be horrible because arsenicum becomes fearful if the arsenicum is really fearful, and if the phosphorus is just too much and feels the fear of the arsenicum and goes for it. So remember the predator and prey part. If they're feeling fear in someone, they might feel more like a predator because they're feeling that the other one has. The phosphorus feels the feelings of the others. But as long as they're balanced, and luckily they were both fairly young when I got them. I think Jimmy was at least one by the time I got Theo. And Theo was a little, you can see a little bit of a baby, about maybe 5 months old or something. And so Jimmy wasn't too jerky with them. And Jimmy's saw him as someone to protect and take care of. So thank goodness it started out that way. Sometimes they do go after each other. Cats do play kind of rough. If they're running and playing and there's horrible screaming, fur is flying, and there are bite wounds, that is not okay. That is never okay. If they're just running and chasing each other, that can be a lot of fun. I did used to see with both of them that they would sometimes grab the back of the other one's neck, which is kind of a mating type of thing. If Theo did that to Jimmy, Jimmy would just sit there. If Jimmy did that to Theo, Theo would cry for me to come protect him, and I'd have to peel Jimmy off of him. That hasn't happened in a very long time because they're both doing so well. Yeah, Jimmy's like, whatever, I'm fine. He didn't need me to come get him. And isn't that so cute? Yin and yang cats. Once they're balanced, they're a perfect pair. They actually do this quite a bit. You should see how many pictures I have with them. So many. I'm going to do a couple other, this is another cat family that I've been seeing for several years. I used to see their last 2 cats, and these are the 2 cats that they got several years ago now. I think they're like 8 years old now. And one of them is Henry, and he is one handsome boy. He has a little white tip on his tail and otherwise is black. He's so handsome. And he was about 5 months old when I saw him, and he'd had a suppressed coryza. He had been suppressed with medications and a little bit of photophobia. But by the time I saw him, he was really doing pretty well. It was pretty suppressed. I couldn't really see much. Prior to the suppression, she said he would sneeze with swallowing. So he was expectorating something and swallowing it back down. He was calm and friendly. I didn't give him anything at the time. I really couldn't see anything at that time. You don't need to give something just because you're there. Lots of times, well, I also do chiropractic. So I adjusted, I checked him for adjustments. I do the physical exam and a Chinese physical exam. And if there's something that needs to be done, there is. And if there isn't, you wait until there is. Hazel, also 5 months at presentation, she was vomiting a small amount of digested food an hour after eating sometimes in the afternoons and evenings. She's more timid than Henry, but loves being petted and purrs, loves going to the screen porch, the open air. Tim had mentioned about pulsatilla. The open air is a big deal, and their symptoms go up and down, and they're very sweet and lovey generally, although they can have a little bit of a harder side sometimes, but they're not hard. She has been on pulsatilla. She had been on pulsatilla for many years, and just like Tim's rheumatoid arthritis person, she went up to 50M. I don't have many patients who've gone up to 50M who are animals, but she's one of them. I just kept going up, and she was on 50M about once a year for several years. But I started lower. I started probably 30C and just kept going up, and she is just magnificent. I have so many pictures of her because she is the most beautiful cat. Anyway, she's 8 now. Look at how pretty. Isn't that just lovely? Isn't she just like a perfect looking cat? She looks a lot like the original African wild cat that our domestic cats came from. I just think she's stunning. So the person didn't tell me that she had received a rabies vaccination and developed hematuria. I knew about the hematuria. I didn't know about the rabies vaccination. And so I continued giving her some lower dose pulsatilla, which didn't resolve anything with the hematuria. Then she went in for some resorptive lesions on 2 teeth, and they were extracted. And this was, again, also after the rabies vaccination several months later. And then she told me, oh, yeah, because I'm like, did she get any vaccines or anything? Or like, what did they do when they went to remove these teeth? Did they do any vaccinations? Oh, she had those last fall. And I said, is that when the blood in the urine started? Yeah, like pretty much immediately after that. Oh, Okay. So I don't do any conventional medicine other than the exam, and the clinic that she goes to and I are really close, but you know, they get new staff and they don't remember to send it, or the client doesn't tell them to send it. And so they sent everything, and it was right after. And so I gave her a dose of Thuya. Thuya is a remedy for, if you look it up, for hematuria post-vaccination. And she cleared right up, cleared right up. That was amazing. And it also is a great remedy for resorptive lesions on the teeth. So cats and horses, very rarely dogs. I think in humans it's rare, but I'm not a human dentist. Maybe some of you human doctors know how often people get resorptive lesions under the gum line. But cats and horses get them really frequently. And I do find cats and horses to be very similar and need lots of similar remedies. I've certainly given Thuya to horses that have had this problem too. And then there's Henry. And Henry, last year, no, longer ago than that, a couple years ago, developed asthma, and he would also chase and stalk Hazel. And the humans were concerned. Now, chasing and stalking, like I said, if it's just a play and they're both having a good time, can be normal, but this wasn't. Hazel was distressed. Screaming, wanting to get away, really didn't like it. And there were no injuries, there were no bite wounds, there wasn't fur flying, but it wasn't good. It wasn't good for Hazel. And Henry seemed distressed. So silica isn't really a remedy you necessarily think of for someone who's stalking someone else. But remember, these are cats, and this is normal cat behavior to stalk and chase. So Henry, because of the symptoms he was having times of day and everything else, needed silica. And we started with 30C. He did wonderfully. The person had actually had him put on steroids immediately. And they took some convincing to get him off of the steroids. But they did, and he did great. He actually really didn't have, I'm trying to think, did he have any coughing after they took him off? Almost none, almost no coughing. And he had been kind of on the thin side too. And his weight is really good. His coat got so shiny on the silica. Eventually, more recently, he's had 200C. He's just doing great. He's had just 2 doses of 200C silica in the last year, and he is doing great. The stalking and chasing intensity is decreased. So I always ask the clients, not just are they doing it, what's the intensity like compared to before? Oh, yeah, that's not intense. They're just really playing. They're really just playing. I mean, he'll stalk and then she kind of rolls over and then they play. So that's normal. This is really normal behavior for cats. And he's not coughing at all. His weight is really good. He is so shiny. He's a good boy. He's not as fearful as he used to be either. He used to be, you know, silica is one of those anticipatory anxiety remedies. And he really doesn't. I mean, he doesn't come running out when I get over there, but, you know, those are usually phosphorus cats. Anyway, if they come running out, hello. But he's easy to find. He doesn't give me a hard time. He's a good boy. And then they are actual sister and brother, and they get along well. They play appropriately, stalking and chasing, where Hazel is also having fun. I love videos, so I ask clients for videos all the time. Short ones, because if they're too long, you know, it's hard to play them, but they are so helpful because, you know, you can't be there for everything. You don't see everything that's going on. And it really, really helps to have this information. Oh, there we go.
And my husband goes, he would let me carry him around all night. Oh, absolutely. He loves human contact. Just loves it.
So here is a video. Sorry, I went too far. Come on, there we go. So Max is one of my very favorite patients. I adore this cat so much. He was 13 when I initially saw him. He had been, it's a really bad story. I didn't really want to write the whole thing on there because it's really sad. He'd been found in a paper bag and he was being strangled in a paper bag. So he has really severe cervical spinal issues from his kittenhood. And ever since they got him when he was young, when they got him as a little kitten, he regurgitated every single day. He would eat his food and regurgitate, eat his food and regurgitate. They'd have to feed him like 3 breakfasts, and he would regurgitate them all. Pretty quickly after eating, he was very, very thin when I first met him. He looked like an old man. I mean, he was 13, and some of us think of 13 as being kind of old, but he looked old at 13. He looked kind of awful, and he's just the sweetest, most darling little honey bunch. Very fine bone, tiny little feet.
And my husband goes, he would let me carry him.
Oh, I'm sorry. That's me talking on there. I'm like, who's talking before? So sorry about that. Actually, that was the client talking. That's the video. So he's just an absolute darling. He wants to play with the other cat, Lucy, so badly because he needs phosphorus, which has no boundaries. I love you. You love me. We all love each other. If we're all happy together, then we're all happy together. The more you feel good, the more I feel good. If you feel good, I feel good. If you feel scared, I might feel aggressive or scared. So, and Lucy doesn't feel scared. We'll talk about Lucy in a little bit. Anyway, he just wants so badly for everybody to love him because he loves everybody because there are no boundaries and he feels your feelings. Very outgoing. He started howling for attention. Actually, I started him off on pulsatilla at the very beginning, and it did help his neck quite a bit. It did help the regurgitation for a while, and then it didn't. And then he started howling for attention, and the people are like, we can't handle this howling. The people are definitely not phosphorus people. And they're like, he would just howl all the time. Wow, I want attention. And we started him off low potency, and he, over the years, has gone up to 1M. He's not needed to go above 1M. But he gets it, I don't know, maybe it depends on what else they do. If he goes and has a dental or something like that, then he needs it again, usually. Sometimes the one person has to go out of town a lot for family problems. And when she's out of town, he tends to get distressed. And so he might need it when eventually after she comes back. But lately he hasn't. He's been doing really well. He is 20 now. 20. He's still playful. He is happy. He's not driving them nuts. They just adore the heck out of him. They were annoyed for a while with the howling, and now with the phosphorus, they are no longer annoyed. They just adore him, as do I. And this is beautiful Lucy. I wish this was a better picture. It's just not best lighting there. But she was 11 when I first met her. She is not interested. She is not interested in you. She is not interested in Max. She is not interested in anything. She wants to sit up high at the highest place on the couch, but way out, right out in public, and just look down on you. I needed to start treating her because she started stretching really strangely with her head down and her rear end up in the air. Now, a non-spayed female cat in heat will also do that because that is a sign of like, hey, I'm in heat, come and breed me. But she's spayed. She's been spayed for a long time. And she had never done this before. So it's not like, didn't seem like an ovarian remnant kind of problem, although I guess I can't guarantee that. But she really did have a back problem. And the person kept saying, she's so awkward. She's so awkward. But her back was really a mess. Her back, her neck, even her tail was really, really in need of adjusting. And she's somewhat appreciative when you do something to her. She's not appreciative like, oh, thank you. She's just like, okay. And then she walks off. Yep, you've taken care of me. Now go away. She is the queen. These are the things that people say about Lucy. This one shows her a little bit better. You can see her very beautiful coloration and a very lovely pink tongue, very bright eyes. She is the queen. This is what the people say. So I really listen to the words that the people use and I write them down exactly. I don't filter them through my own silly head. I just put down really what they say, especially when it's something unusual. And this is what the people say. You must obey her rules. When you have petted her, and by you, that is only one of the people in the household. When that person comes home from work, they must stop what they're doing, sit by her and pet her in the way that she wants, in the place that she wants. And then you're done. Be gone. This is what that person said. And then you were done. Be gone. She loves her throne. This is the other person in the household. She loves her throne. How dare I even consider leaning on her pillow? Everyone is less important than Lucy. She's aloof, beautiful, and she knows it. And a funny thing was, the person also told me they wanted to buy her a pillow that said, "I am the queen." And the person laughed because the person said, "Well, I'm actually the queen, but Lucy thinks she's the queen. Lucy's sure she's the queen. Doesn't think she is. She's sure that she's the queen." And this is what they say. Lucy says, "I'm the focus of your life, and you will bow to my wishes." Now, I know a lot of people say this about cats, but Lucy's unusually this way. And you do what you do, and then you're done. The look she gives at Max when he's annoying and howling, "I'm up here, elevated. You're a peon." These are the actual words that people used. She'll look at him like, "Why am I sharing my space with you? You shouldn't even be around." So I ended up giving Lucy Platina, Platinum Metallicum. Some things they say that are said about Platina is that it has a superiority complex of the highest degree. They literally think they are bigger than you. They're above you. And then if you look in generalities, stretching ameliorates, because remember, she's stretching. She's doing this weird stretch thing. It's very strange. And it ameliorates. Platina is a 3 for that. And for back constriction, Platina is also a 3. So there's Lucy doing that thing in the background. I don't know how well you can see that, but she's doing that thing where she has her head down and her butt kind of up. And she always wanted nothing to do with Max, was always up higher and looked down on him, really didn't like him. But now they've both had the remedies that are best for them. She allows him to share the couch and sometimes even allows him to touch her. Oh, I'm sorry, I wrote this when Max was 19. He has turned 20 since. He's active and happy, and Lucy is 17 with no problems.
Yeah.
Oh, I guess that was another. Well, we don't need to listen to that. This is Linus and Gus. These are brother cats that I first saw in 2021. And it started out great when they were babies together. They were great. And then Linus had other ideas. I saw them first, not for homeopathy. I just did exams and adjusted them as needed. And Linus had other ideas. And I saw them for homeopathy after he had given Gus a couple of bad bite abscesses. And Gus was put on antibiotics and the wounds were flushed. I mean, they were pretty significant bite abscesses. And here they are. So Linus is the one on the ground and Gus is the gray and white. This is how they play now that they're all better, but I don't have a picture of them attacking each other, thank goodness. Linus is hilarious. I come over there and he gets into my coat. I lay my coat down on the couch and he gets into the sleeves of my coat, gets in there because there are no boundaries. And when I examine him, he lays on his back and I can touch every single part of his body and he loves all of it. So Phosphorus loves touch, massage, rubbing, anything. Just please touch me, connect with me, especially if you are in a place that feels good to them. So if you're in a good place, so I always make myself in a good place before I see any patients, but especially cats, because they feel better when you feel better. And Phosphorus feels your feelings. So get yourself nice and calm and feel grounded and in a good place. And then he can't get enough. And that's what his person says. He can't get enough attention. He just can't. She has to hold him all the time. Luckily, she works from home. He allows every part of his body to be examined and loves it, but he stalks Gus. I stalked him badly. Like he would see him, he would be usually up above, and Gus would be going in a different part of the room, and he'd start stalking, then he'd chase, and then Gus would go and hide. So Gus is very soft, extremely soft, great appetite. This is interesting. I forgot to mention this with Theo and Jimmy, but it's the same thing. Phosphorus wants the other animal to feel very good, so they let them eat their food. And that's exactly what happens at my house too. Jimmy, if I have to keep Theo away, or he will eat Jimmy's food, because Jimmy's like, okay, because eating isn't as big of a deal. It's more, I want you to feel good because then I feel good too. So Gus will eat Linus's food and Linus lets him. He hides to get away when Linus stalks him. He tends to go under furniture. He's definitely not as outgoing as Linus, but he's not a total scaredy cat when I'm there either. But he's more fearful. And sometimes when things had been going badly, I could barely examine him because he was really scared. And this situation, no matter what I did with Linus, because the person really wanted me to work on Linus because was blaming Linus for all the problems, but it isn't just a one cat problem. It's a balance, right? You have to get them both in the right place. So I'm like, I really need to treat Gus. And once we figured out that Gus needed arsenicum, he did need arnica a couple times because of his wounds. But once we figured out he needed arsenicum and I gave that, everything stopped. No more going to the vet with abscesses, with bite wound abscesses, but it didn't improve until Gus had the arsenicum. And now they're friends again. They play together. If they're stalking by Linus, Gus doesn't put up with it and Linus backs off because Gus will be like, no, I'm not running and hiding. I'm going to give you a swat. And then he's like, oh, okay. And now they cuddle and play together again, just like when they were little babies. So everyone is happy in that household. This is a little bit different situation. This is Basil. Basil was very old by the time I met her. I think she was 19 and extremely outgoing. I go to this person lives in a condo and I knock on the door and Basil comes down the hallway to greet me. Hello, it's so good to see you. Very outgoing. Everybody loves Basil. He takes her for walk. He would take her for walks on a with a harness outside and everybody wanted to see her. She loved to go for walks. She loved to walk down the hall in the condo. It's really great. She sits in strangers' laps. She already had chronic kidney disease by that time I saw her with much thirst, drinking a lot. This is very, very common in cats for all you non-veterinarians. All of us veterinarians know about this, but kidney disease is extremely common in cats, especially on cats who get dry food. Especially in cats who get dry food. So if any of you are not vets and have cats or know people with cats or want to give them any advice, the big advice is get them off of dry food. Sometimes it's a little challenging. Catinfo.org is a nice website if they need a little help with that. Anyway, she got phosphorus 30C. She had been chronically vomiting for a while. She lived to be 22, so I saw her for several years. She did really, really well, but they did give her some other medications from another vet, and I don't push people. I really don't push people because I want to do what people are comfortable with, and I don't want them to not do something to help their animal. And so I'm just like, okay, it might be better if she wasn't on that, but okay. And so she was finally euthanized with also heart failure. And she was always the center of attention. She mostly ignored Rue, and Rue seemed to like her, but they pretty much ignored each other, the two cats. So Rue's the other cat. So here's Rue. Rue is also sweet, pretty sweet, not like Basil though. Not particularly fearful, but Basil was there first. So Basil was always the one who got the attention. It seemed that Rue would really like more attention from her person. She always wanted more attention, but she didn't push it when Basil was alive. But when Basil was alive, she did occasionally have some upper respiratory stridor and a dull coat when she was having the respiratory stridor. It wasn't very severe. It was fairly minor, but we tried some phosphorus, which helped, some pulsatilla, which helped. She was also, she wanted to be held. She wanted to be cuddled. She didn't really mind me examining her, but she wasn't as into it as Basil. But then after Basil passed away, she began to vomit in the early mornings. She always wanted to be held by her person still, wanted to sit in his lap, wanted to be cuddled. But he also noted she seemed maybe hearing less well, afraid of some noises, which he didn't really notice before. And he didn't think that she really cared that Basil had died because they really weren't close. They didn't do anything together. And I didn't get anywhere with the pulsatilla with her. And when he said, I said, what do you think she's saying when she's howling? She just walked down the hallway and howl. And there's really no sign of hyperthyroidism. So hyperthyroidism can cause cats to be very howly, and it's very common in cats also. And I said, what do you think and she didn't have a thyroid nodule that I could palpate. That doesn't mean she's not hyperthyroid, but her heart rate is slow. It's like 140, and that really doesn't go. You have a high heart rate if you have hyperthyroidism and you're a cat. So I'm like, what is she saying? And he says, she's saying, you aren't helping me, and she's complaining. And he's like, I don't know what to do. It just feels like she's complaining and I never do the right thing. And so then I'm like, so I looked up, I did a little workup and everything, and I'm like, Ignatia. Ignatia is a plant like pulsatilla, but they're a little bit complainier. They're kind of complaining. I have a human that is a chronic Ignatia. Been on Ignatia for years. This is an elderly person with also chronic kidney disease and very complaining. Well, since we started the Ignatia, though, much better that way, much better. But still, I mean, they are a very elderly person, so they do have certain opinions, but they're quite opinionated. Have some kind of unusual ideas too, I think. Also, they are fastidious, but it's almost an unusual kind of fastidiousness. They want things done their way. They're very kind of persnickety. And this is what we saw with Rue. She's gotten so much better with Ignatia. So Ignatia is definitely a suppressed grief remedy. And they can really yell about their frustrations or not say anything. They might cry a lot when someone dies, or they might not. And even though the cats didn't appear to be close, they shared the space, and we don't know. We don't always know what the feeling is when somebody else passes. And Ignatia may not. So like my human that's on Ignatia as a chronic, that person's spouse passed away more than 10 years ago. And we would talk about it, but very matter-of-factly. And finally, I'm like, did you cry when they died? Oh, I just sobbed and sobbed and sobbed. And then I thought, that's enough of that. And Rue is a lot like that. And she's stopped howling and she's feeling good. This is two barn kitties, Olive and Newt. And Olive was always the healthy kitty. I know she doesn't look 100% there. She's a little goo in her eyes, but she's a barn kitty, you guys. So she prone to getting just a smidge dirtier. And this is when they first got her too. The mom had dropped these kittens off in the barn and then left them. And after her spay, she needed Arnica 30C once, and she's really been great ever since. I mean, really quite great. Newt, however, was not. Immediately, Newt had a big hydrocephalic head. Couldn't even hold it up, unable to eat. The person who I see all their other animals called me up and said, hey, these kittens showed up and this one's got this giant head and it feels like an open fontanelle and can't eat. And I'm like, well, let's try Carb 30C. I mean, there are a whole bunch of developmental remedies, of course. I could have said Burrito Carb. I could have said lots of things, sulfur, whatever. There's so many developmental remedies under generalities development, but I'm just like, let's just start here. Let's just try Calc Carb because it's kind of basic, and worked great. Next morning, eating well. Over time, the hydrocephalus resolved, completely resolved. She would just follow the other kitty around, Olive. We did repeat her Calc Carb 30C after her spay. They really didn't want any more cats on the farm. And now you can't even really tell the difference between the two sisters. It took 2 doses of Calc Carb 30C for a hydrocephalic kitten with an open fontanelle to be fine, even after a spay. I mean, that's pretty remarkable, isn't it? Yay. Thank you, Hahnemann. Here's another couple kitties. This is Raven. He was incredibly fearful, especially of, we didn't really know what. The person didn't really know what. She thought maybe noises. She didn't know. All of a sudden, he'd just like get it into his head that he was scared to death of something. And he would escape the house through the tiniest openings. Luckily, her whole yard has cat fencing that's completely covered over the top with chicken wire. But he would just be scared to death and like to death. It seemed like, but at the same time, that he was so scared. I could examine him and he would be okay, but you could see he was kind of on the edge of, I'm going to take off, I need to escape. He had a heart rate of 92. Pretty weird, pretty weird. So because of the extremeness of his fear, and he really didn't have a lot of physical symptoms other than the bradycardia. He maybe had a little bit of dark earwax, but there's like a million. I mean, there's a lot of remedies for that. So I just went with stramonium because of how fearful he was and how much he wanted to escape. I mean, that is stramonium, is like, I need to escape. I am scared to death and need to escape. And that worked great. He was on it for a long time. And he became a little darling. He became a little darling. Stopped doing that altogether. That never happened again after he got stramonium. And then there's shadow. I have given other talks on shadow. I don't know if in this group, but strangely enough, shadow is on lac leoninum for a lot of reasons. He acts like a wild animal. He will attack large animals outside. She used to not have the whole yard fenced, and he would go out and go after like foxes and coyotes and everything, and everyone was afraid of him. But he's very, very, very charismatic. He's very handsome and he's enormous. He's an 18-pound cat that should be 18 pounds, not a heavy cat at all, just huge. And he's the king, and he does some weird sexual stuff on the arm of the owner that he must do every night. And she used all the words saying like, this is how he's acting, and he's like the king of the jungle and all this. Anyway, he's done great on lac leoninum. He started really having problems when another cat in the household had died, and he'd just go in the basement and howl. And Ignatia did nothing for him. And so that's why we eventually got to lac leoninum. But he was not interested in Raven. She got Raven after the other cat had died. And Raven really, really wants his attention. And he might put him down with a big paw when Raven annoys and just take one of his paws and just like hold him down, like stop it. Rarely would give him a quick grooming. But as Raven got treated and as he got his lac leoninum, over time he has begun to take care of Raven. And now they're getting along. Isn't that so cute? Raven now, after the stramonium, he's on pulsatilla because he had some chronic ear issues and that resolved them. And she would call him a little baby. And the ear issues, like they were hot and kind of red and just really irritating, a lot of discharge. But there wasn't anything else in there. And they completely resolved. And she'd always say, he's just a little baby. And when I talk to him, I want to say that too. I'm like, oh, you little baby, who's a little baby? And he's very small too. And he likes to be gently carried. And he's cared for by the king, Mr. lac leoninum Shadow. So the king takes care of his minions. So it's a little bit like Platina, except for Platina doesn't care. They're like, okay, I'll deign to let you be near me. But lac leo, being a lac remedy, one of the milk remedies, they care about those around them and those in their environment. And remember that cats will be cats. I just love this one. So you can't really look at cats in the same way you would look at humans. You can't. They're prey and predator. They're going to do things like knock things off the counter. I mean, they're little physicists. They're always doing physics experiments, right? How fast will this fall? How many times do I need to hit it before it falls? So you just have to remember that they're still cats. So some other things that you can do to help cats in these situations where they're having problems with other cats in the household. Feel Away, I still really like Feel Away. There's a plug-in, there's a spray, there's a collar. I don't like the collar, but those are really nice. Flower essences are great. I did do those with Gus and Linus for a while before she finally let me treat Gus. and it helped a bit, but not enough. Holly is great for victim and aggressor. Chicory is for needy cats, which would be like the pulsatilla or the phosphorus cats. Water violet is for very aloof, like Lucy, the Platina kitty. Block areas off to keep them away from each other. Like my two kitties, Theo would eat Jimmy's food, so Theo eats in the basement with the door closed. And then Jimmy eats upstairs so that Theo doesn't take away his food. Lots and lots of enrichment. You can't have enough. These are wild animals that chose to come in our homes. Cat trees, toys, catios, climbing areas. They have the ones where you can build them on your walls. Those are really cool. Do I have that? No, I wish I did. Special treats like the Tiki Cat squeeze treats and churu. You can teach tricks. My oldest child taught her cat probably 100 tricks. He is so smart. SpaceCatAcademy.com is one of the places you can go to learn cat tricks. They can learn tricks. But I also wanted to talk about, and I know I don't have a lot of time for this, is an unusual remedy for two humans, because I'm also a human homeopath. And this just was so weird to me. Both of the humans have, I thought it was said hidradenitis suppurativa, but I think, Bob, you pronounce it differently, so I'm probably saying it wrong. So I'm sorry about that. Anyway, it's weird because as homeopaths, we know you don't treat for the disease. You don't treat for the disease. But strangely enough, these people had the same things, same things they said, and the same things, same disease. So the reason I brought this one up was a few years ago when I was at the Joint American Homeopathic Conference. Farouk Master was asked a question and said, hey, how do you treat this disease? And he said, this is the one disease he has never been able to cure with homeopathy. And so I kind of kept that in mind, because at that time I was already seeing one of these people several years ago. So the definition, when you look it up, it says a chronic, non-contagious inflammatory skin condition causing painful lumps, abscesses, and scarring, usually in the armpits or groin. I think one of the people also had it under her breasts, I want to say, at one point. And this is kind of what happens with it. The hair follicle gets clogged, and then keratin and sweat build up, and the bacteria breed inside the hair follicle, and then has more than it can hold, and then it bursts, and it's really painful, and a swollen lump filled with pus. The material that comes out spreads to nearby hair follicles. Lots of times it smells bad. So the people are very, very sensitive to that, oh, I have these gross things that hurt, they're ugly, and they smell bad. And more lumps form, and they also they have scarring. So it's making me think about the keloids that we were discussing before. They have lots of scarring, and then they tunnel under the skin. And both of these people have had the tunneling under the skin. The cause of this is what the American Academy of Dermatology says, the cause of this disease is still a bit of a mystery. While studying it, some researchers have found that it might be an autoimmune disease. This is what it still says under American Academy of Dermatology. People develop antibodies, more research is needed. So it appears to be autoimmune. It can run in families. So there's usually a trigger, and it can come on anytime between puberty and like 40-ish. So cigarette smoking is the most common trigger, and being overweight is a trigger. Both of these people that I saw are significantly overweight. More often in females between puberty and menopause, but it comes on usually by 40, and it appears hormone related. So different things happen with cycles with the disease. More often in those with psoriasis, so you have one skin disease, you might have another one, and it can lead to squamous cell carcinoma, especially in people with darker skin. The allopathic treatments, of course, there's soaps and cleaning, but antibiotics, hormones, and biologics are the big things that are used these days. Do they fix it? As we know, no. Interestingly enough, both of these humans who had the same disease had very similar feelings. And these are all words that they used. I took them directly from what they said from both of these people. The line between my home and work is blurry. Lines are blurred. They also both, as children, had had households where they had to go back and forth. And they felt like different people in both of those places, and like they didn't belong in both of those places. I know that feeling is probably not terribly unusual in people who don't live with both parents or have parents who are not together. But they were really, really affected by this and talked about it a lot. They know their boundaries. They get pushed to the wayside very lonely, disrespected. It weighs on me. They both use the word rift. You don't have a place. Mixed signals, boundaries, everything blurry. You can see blurry is a big one, and not having a place and pushed to the wayside. Wasn't sure where I was supposed to be, who I was supposed to be. Tumultuous, pretended I didn't exist. It's hard when two worlds would meet. They would say that about childhood and adulthood. Wasn't a problem as long as the two worlds didn't come together. There's a disconnect. There's also this feeling of deception, misunderstood, being unheard, feeling invisible, feeling not seen, disturbing their peace. They just want peace. They had to pretend, internalize, couldn't talk about anything, constant state of fear and holding my breath. They felt like two different people in different places, like they had two different roles to play in those households as children especially. They felt abandoned, like they were being iced out. As they talked about their feelings, they'd say that parents had no feelings for their child. They had to have a poker face. You're not there at all, invisible. They felt unworthy and like victims. Interesting. This was really interesting. Clutter being thrown at you. This came up more than once for both of these people, and a lot about floating and body fluid, like a lot. A lot about privacy, feeling exposed, not wanting to. And strangely enough, actually both of them said salt water is very quenching. They would drink water and put salt in it. Like people with POTS need to have salt in it. It wasn't because they had POTS. It's because they wanted it. The first person, said that octopus is their favorite animal. Nothing in the world is as fascinating as an octopus. I found out later, not during the intake, that they would watch octopus videos to feel calm. And then they were talking about how a giant snake at the zoo was like a rat conveyor belt, and talked about the movement of the rat going through the snake. It wasn't like they were fascinated by the snake. They were fascinated by the rat conveyor belt movement. And think about that movement going up and down, up and down. They would do that with their hands as they were telling me this. So the second person, I said, they were talking about feeling unworthy. And so and worthiness. And so I said, worthiness, can you tell me more? And they said, it's something really solid. And they had their hands in the shape of a ball, like a really solid thing. And I said, can you tell me more about this object? And they said, it's dark in color, black or navy blue. It's rounded corners instead of sharp. They're rounded. It doesn't have a smell. It's quiet. There's no sound, no white noise, air around it, energy around it, just there. Everyone knows it's there. Everyone just passes by it. They know it's there. It doesn't make us feel one way or another. It's just there on the ground. It doesn't have to do anything. And I said, if you were to touch it, what would it feel like? If I were to touch it, it would feel like some sort of plastic. And it took this person a long time to think about this. They just went into the feeling of the actual substance. This is what they were discussing as the substance that the substance of the remedy. Shape is like a special mold shape. They couldn't describe it any further. And they talked a lot about camouflage. They talked a lot about shame and gross. And you can imagine if you have these horrible, painful things, but also it smells, right? Shame, gross, cysts, scar tissue, pain, gross. They both brought up swimming, and a big problem for them is they couldn't go swimming because they can't wear a suit because they don't want anyone to see this, right? I mean, your axillas are open when you're swimming, usually in a swimsuit. I guess they could wear a whole suit, but also some kind of clothing is very uncomfortable too. And they talked about shoving that way down, and they would surface and pop and then go down again. So it's kind of like the tunneling and the stuff coming up, and then it goes back down. It's like a cut you put salt in. It just stings and dissipates. So think about these words they're using, like swimming and dissipating and surface and pop and go down again. They used it showing with their fingers, tight pulling and congested. They were talking about the scar tissue on the surface, but underneath underneath there was this tunneling, and the healing is going on underneath. They talked about unveiling, opening larger at the top and releasing, and channels and tunnels like a subway system. Kind of like the rat conveyor belt, right? And one of them had an ovarian cyst and said, I said, tell me more. And they said, it was like this sense of urgency wasn't strangulating enough. The doctors didn't do surgery fast enough. It was a ginormous cyst with lots of liquid. So this person had some very horrible, painful things. They both did have a lot of problems with pregnancy and labor. One almost died with preeclampsia. It was an emergency when I gave birth. I had a really high pain tolerance. I'm disconnected from pain. I trained myself to not notice, but also there's this magnifying, multiplying. They're talking about the cysts and everything, but they're also talking about the feelings. And I can hear, smell, my skin, everything is very sensitive. So not only can they have all this pain, but push it down, but they also are very, very sensitive. To me, it sounded like they were having kind of a mix of laccaninum and sepia. They felt like unworthy, a victim. They felt ugly and smelly and icky. And then the sepia of leave me alone, go away, leave me alone, and a lot about water. So C remedies, this is from Inter-Homeopathy. The relationship problems can start with the mother. There's a lot about mother with both of these people, a lot. Overeating, lack of trust, problems connecting to other people, withdrawing inside of themselves, difficulty with communication, problems relating to their partner or children or close family. There's a lot of estrangement. They both had a lot of issues with estrangement. Feeling forsaken and abandoned, misunderstood, need for privacy, alone in their own space. So this, and also this is again C remedies, not be disturbed, intrusion, resistant to change, anxieties about moving house, about glands, all glands, watery discharges, autoimmune disease. So again, those are C remedies. So remember, the one person could not get enough of octopus, just thought it was the most interesting creature. So this was the first person I saw. So this is just from Nat Geo's website. Just like sepia, an octopus will release a cloud of black ink to obscure its attacker's view, giving it time to swim away. The ink contains a substance that dulls a predator's sense of smell, making the fleeing octopus harder to track, using their ink to disorient their victims before attacking. It's made from mucus-secreting glands and melanin-secreting glands. I find that very interesting, from glands. Looking specifically, this octopus and Octopus vulgaris, which happens to be the kingpin, the king of the octopus family in homeopathy. And this is from animaldiversity.org. This is about when they go to lay their eggs. They become restless. They search for a sheltered place without disturbance. And they talk about secretions from the oviductal glands together with the mucus. Now, both of these people talked about secretions and mucus, and I'm sorry I didn't say more about that in there, but they definitely talked about how this looked, what the HA looks like, or HS looks like. They're used to stick the egg stalks together in strings and attach these to a substrate. On rocky shores, females find a hole, a crevice, or a sheltered place, and they often protect their homes with shells, stones, and other solid objects that they gather. So these people want to be alone. They want to be left alone. They want their privacy. They're very, very, very sensitive, and they've got this stringy, mucusy stuff that is coming out of their bodies. The female rarely leaves the egg mass. Egg cleaning includes cleaning the eggs with the arm tips and directing jets of water from the funnel through the strings. It's like shooting through this stuff, almost like the stuff coming out of their bodies, like of these two people. Intruders, including prey, are pushed away, although if crabs are there, they'll eat them. Females die shortly after the hatching of the last embryos, after losing 1/3 of their pre-spawning weight. And at least one of these people thought they were going to die from preeclampsia, and almost did. So I talked to Lori Dack, who was the head of the school that I went to, Northwestern Academy of Homeopathy. She isn't involved with the school anymore, but she has a practice in Vancouver, Canada. And she's like, here's what it, because when I looked this up, it was all in German and I could not get my Google Translate to work. So I'm like, Lori, can you help me? And she said, this is the thing about, she told me Octopus vulgaris is the kingpin, octopus. And she said, what it is I'm a different person wherever I go. Really, really shapeshifters, contort, warp, morph, change, mimic, imitate. That's what these people were like. I'm a different person here than I am here. I'm a different person here than I am here, even as adults at their jobs, everywhere they go, they're like different. So they can fit in. They're hiding, pulling in and hiding, often solitary and pull inside. They're unobtrusive in the background, slide along, slink, wrap around, and twine in the dark. They also talk about expanding, enlarging, swelling up. That's like the cysts building up, right? And everything coming out, and feelings of being pulled apart. So both of these people got Octopus vulgaris. I did try sepia on both of these people too, and no improvement. Actually, it didn't go well at all. And one person right now is on 30C. I did have them do some LMs for a while. It went well for a while and then it just didn't. And they really just needed 30C. And they've really needed 30C not often. And their HS is not even active anymore. I mean, they've both had this since puberty. And both of these people are close to menopause. Well, one of them had a hysterectomy, but they're close to menopause age. So this is many decades, right, of this disease. They're not in menopause. I mean, the one had a hysterectomy, but not an ovariohysterectomy. Anyway, no signs anymore. Quite happy. When I first met this person, the one who got the 30C, I could not understand what she was talking about. I mean, it was really hard it was like she was talking in riddles or metaphors or something all the time. I really had a hard time following her. Now she's straightforward. I understand what she's doing. She's made big decisions about her life and her business. She's very happy with the decisions she's making. She's not so distressed anymore. She feels a lot better about her family. Her life is incredibly better. The second human right now is on LM1. I had given many different potencies. I had also given other LMs, and now we went back to LM1 again. And the reason I went back to LM1 on this person is they took Ozempic. They do have type 2 diabetes too, which I'm sorry I didn't mention before, but they also do. And their doctor wanted them to go on it. And when that happened, I needed to give an LM. I mean, really, they were having some trouble, especially physical. And since they're taking the LM1, and actually I'm having them take it twice a day right now, they are feeling very good. They used to hide in their closet to talk to me. So we would be Zooming while they were in their closet because they didn't want anyone around. And they felt it was the only place they were away from everybody, and they didn't want anyone to come in. And then sometimes they would call from their car too. Now they're much more comfortable. They have convinced their spouse to talk to the sibling who wouldn't move out of the house. And so that's happening. And they've wanted this for many, many years. They want their space back. They are not feeling pain, and their HS is doing well. So those are my cases. And I think that's it. Does anybody have any questions?
It's interesting. I mean, the results speak for themselves in a situation that, like Dr. Master said, he had no success. So whenever you can move the needle on a case like that, that's a very good thing. I wonder, the remedy is made, you mentioned, because like sepia, it's made from the ink of the cuttlefish.
Right.
With octopus, it's made from the ink, or it's made from the whole animal?
I think it's actually made from the octopus.
Okay.
Yeah, it's really hard to find information in this one. I had to join that one European site that is in German, but the whole thing was in German, so I couldn't get exactly what it was. So the information I have is just from Lori. In fact, if I look up on I think the only one that's listed in the Synergy program for octopus is that blue-ringed octopus, Octopus maculosus. That's the blue-ringed one, and they don't say.
In Synergy, I only see in the reference of Octopus vulgaris. That's the only thing I see, and I see one case in.
Who proved it?
Yeah, I don't think it was proven. It obviously it's a helpful remedy. It should be proven.
Yeah, I can't find a proving on it, but
there is in that German site.
I don't see one.
Supposedly it was poorly, it wasn't very well proven, but Lori said there was a proving and she knew about it because I don't know if she was involved in it, but she kind of knows all the things. So, yeah, she said, because I said I couldn't read it in German, I couldn't get it translated, and she said, well, these are the things I know about it. So I think it wasn't super well proven.
It's always good to have a proving because, I mean, you prescribed the remedy. What made you think, was it when the person said octopus? Is that what made you, or what led you? Because otherwise, I mean, without
yeah,
the remedy,
it was the octopus.
Yeah.
And
so you have a thought that kind of
but and then it was also the snake thing, because it was when they were talking about the snake being a rat conveyor belt and the way they moved their hands was like an octopus. Both of these people said the thing they want to do more than anything else is swim in the ocean. Mm-hmm. And they can't because of their disease.
Salt water. It would be interesting to have see a proving, because it's like there's a lot of mental emotional symptoms, and I don't know, personally I find it hard to prescribe based on that because it's so, some of it's subjective. But if you have a proving, then you have some physical symptoms that obviously the hydradenitis is one, but because it helped that. But yeah, if you have a proving, then you have some other characteristics that you.
Well, there is a proving. It's just in German.
I have a proving in German, but it's not for vulgaris. It's for a little octopus.
There are several. There is Octopus lesser. So at first I couldn't get Octopus vulgaris. So I did start that person. The first person, I think I did sepia, and then I did Octopus lesser because I couldn't get vulgaris. They had to order it from Europe. And lesser did nothing. And then there's the blue ringed octopus, which is the maculosa, I think. In fact, I could see what I have sitting over here. I've got all my remedies right here. I think that's all I had. Let's see.
Yeah, I saw it was available IME and Remedia up to like 10M maybe, 1M or 10M.
And it took a while to get the different potencies because they could only get so many, you know, I had to ask for like one thing at a time. Oh, thanks for putting that up, Susan.
Yeah, it's not vulgaris though.
But there is a vulgaris on that one site.
I'm hunting.
There is, and I can't remember. I'm sorry, I can't remember the site, and I didn't do anything about it because I couldn't read it.
Jody, if you want, there's a kind of a member of the group, Anya Troche, and she's a medical doctor, psychiatrist, but she's a homeopath in Toronto. She's German. I mean, that's her native language. Maybe she could help you. I can give you her email if you like.
I would love that, and I could. Yeah, that would be fantastic.
And I know people who could translate too.
Her email is trojeanja@gmail.com. That's TROJEANJA@gmail.com.
I'm sorry, could you, just a sec here. I'm trying to get to the right place on my phone here. Could you say that one more time?
It's trojeanja@gmail.com. So that's T as in Tom, R-O-J as in Jean, EANJA@gmail.com.
You know what? It kind of cut out a little bit while you
were
talking.
What did you get?
I had to erase it because there were other voices in there, and then it would cut out, so I couldn't hear.
So it's TROJE.
Okay.
Anja, ANJA, no dot in between, @gmail.
Thank you.
Anja@gmail.
Thank you.
Yeah, that's it.
Thank you so much.
Yeah, it'd be interesting to have the proving. Once you get a proving, then it's otherwise it's kind of I know I did a monograph on ferrum phos. It was, they call it like breech delivery, where we start using it clinically without knowing more characteristic symptoms, and it's kind of a bit hard to prescribe. But then when you do a proving, then you get some more characteristics, and then you have more cases, and then it becomes, right now it's like an infant remedy. It's like we know something about it. It's helpful for this condition, amazingly. But it's like if we could develop it more with provings, and maybe there's some toxicology, and you add it all together, and then you have to be clear what it's made from. It's interesting, like carcinosin. Some people really like to prescribe carcinosin, but when you do a little research, you find out there's 50 different types of carcinosin. It's like you can do from carcinosin melanoma, carcinosin. The standard carcinosin is from the secretions from a breast tumor, from a pancreas tumor, from a liver tumor, from a, it's like what are you really proving? It's always good to pin that down so it's reproducible. Otherwise, when the scientists come and look at homeopathy, we look a little not so scientific if we're not, haven't nailed it down and followed our own rules, which are to do proving. But
I mean,
remedy can
I
be
do know there is a proving. I just couldn't read it.
I just put a paper from 2021 in that's bioactive compounds from Octopus vulgaris ink extracts exerted anti-proliferative and anti-inflammatory effects in vitro. And I've read the abstract, but I haven't read the full paper.
I would think the proving would be best to do with the because if you look at the sepia, it's
ink. Yeah.
It was used as ink, and that's people were like using the ink and taking their quills and sucking on it, and that's how the first provings came about. I would think the ink would be the place to start, but I don't know. Like you said, you don't know what they're using, what one manufacturer or another is using, what part of the animal they're using.
Well, that's the challenge. If we're grinding up an octopus, or are we grinding up? Yeah.
Then it's not really a toxic substance. It's more of a sarcode or something. It's something different. So.
Well, what I'm seeing, I mean, this says AI overview, so take it with a grain of salt, but it says the source is created from the common octopus itself, that tissues.
So Jody, this is Bob Sigari. Can you just explain once again for the audience, where did you buy the remedy?
I used the Minnesota Remedy Room, and they had to get it from Europe.
It's called the Minnesota Remedy Group.
Room.
Minnesota.
I can give you that information. Let me just see their website. Just a sec.
Remedia has it in INE.
That's where I order almost everything from. It's let's see, Remedy Room. So it's remedies at homeovista.org.
Bob's going to get it and try it on his hidradenitis suppurativa patients, and then he can do a case series report.
Well, I don't know that it. I mean, it has to fit the
person.
It definitely has to fit the person, not just the disease. Right. Obviously, as we know, and these two people were so similar, and I wish they could meet each other. Is how I felt. I'm like, you two need to meet each other so you could talk about this together. I mean, they would get each other because they get it, although they're. Yeah, now they are able to talk about things better, so that would be helpful. But
yeah, right. Like Francine just said, it was meant to be that you saw both of those patients within the same span of time. So, I mean, in all the hidradenitis suppurativa patients I've seen, I've never ever heard anybody, meet that type of like mental and emotional. But I mean, you figure, I mean, you think of all the patients that have come from divorced families, and they've been in the same scenario. One weekend you go to one, and you don't fit in. One weekend you go to the other parent, and
right.
Siblings. So I could see that being a common scenario, but I have to look for stuff like that. That's interesting. So okay, so you bought it from remedies at homeovista.org, and then they sent away to Europe or something, and you just asked for like Octopus vulgaris and 30C or LM.
Yeah, I asked for Octopus. Initially, I asked for Octopus vulgaris and like 30C and 200C. And they said, we don't have that. We'll order it, but we'll give you Octopus Lesser because we have that. And I
Yeah.
said, okay, I'll try that, but that didn't work.
So just the Octopus vulgaris from Europe. Okay.
Yeah, and the Octopus Lesser I did try and it
Yeah.
didn't work. And I did try sepia prior to that and it didn't work. And I mean, like, no, there was no change in how they felt. There was no movement at all. And yeah, so then they were able to get it in the different potencies. So now they do have it. If you contact them, because I had to get that remedy, they do have it.
Yeah.
I've had several clients on very unusual remedies that they've had to order from Europe. I have one person on ruby-throated hummingbird. That one took 4 months to get in. That was really unusual, is because it was only at one pharmacy in Europe and they were closed for months. So
I put some links in the chat for places that the
Thank you.
duck is telling me you can find it. So Remedia's got it. Homeopathy Online is supposed to have it. I haven't checked. I honestly haven't checked to see. I can't think that Hahnemann would have it. Well, maybe they will. I don't know. Just a minute.
IHMA Organics has it.
Yeah, that's the other one
Yeah.
that I have.
it might have been I&E that they had to get it from, but they were closed over the holidays and then they had nobody working for a while and it just took a long time to get it in. Oh, that was the ruby-throated hummingbird. Sorry about that. I have somebody on Gallio Couve Hepar, which is a tiger shark liver. That one took a while to get into. That person, complete cure, like shocking. I've had some people with some very strange remedies.
So Jody, the two Octopus vulgaris cases of hidradenitis suppurativa that you had, I mean, that would be a great letter to the editor of two quick cases like that. Letter to the editor for homeopathy. You got to publish that. Even if you don't have any photos of the hidradenitis, at least if you could just like make it like a five paragraph letter to the editor, I think homeopathy would publish it. I mean, that's outstanding. You got to like send it somewhere, or an AIH journal or something. But I think homeopathy, I think, would get you like more of a worldwide. People need to know about that. That's really interesting.
And it's such a difficult disease. I mean, do you all see very many people with that?
Oh yeah, I've seen a few, and like Dr. Master, that's been my experience. No. I can remember one patient was a softball player, and I thought it was probably the friction of, she was a pitcher always doing that, but no.
It's a terrible condition, and we see it like not as frequently as scarring acne, but it's out there, especially in the darker skinned populations. But anybody can get it. It's so bad. There's no cure for it. The big thing nowadays is everybody gets stuck on Humira, which is adalimumab, which is a biologic, and it does work. Makes them maybe 40-50% better. It definitely helps them not be suicidal because it really ruins your life. But,
Yeah.
But I mean, the Humira, you just kind of stay on it, and you might get 50% improvement, but you're probably not going to clear them up completely. And then it stops working, and then you have another medicine. So I mean, this is a real cure. This is not just like spend thousands of dollars and keep it under control. I mean, so that's why you really should just do a letter to the editor of some big journal like homeopathy, and it doesn't have to be a complete case. Just say what you said, and the world needs to know about that.
Yeah, at least mention the characteristic things that led you to it, because that's what, for someone else to replicate it, like you said, you can't just prescribe. We can't just prescribe on the name of the disease. We have to go based on what's characteristic, and you had some characteristics there for both of them. So
yeah, and
then others can confirm that. Maybe certain of those symptoms will be more important, some less.
Yeah, and then the
clinical experience is the only way to determine that.
The last paragraph, you could just say, so in summary, I've had 2 patients with recalcitrant hidradenitis suppurativa, very serious cases. 2 people that both came from broken families and felt like they were just being put from one family to the other on each week, whatever, and they felt they didn't. All the characteristic things you just said, that's all you need. I mean, just get it out there, and get it published. That's like awesome.
Okay, thank you. Those are great ideas, and just have to get my act together and do it.
Well, I'm sure that somebody in this group would you know, if you drafted, somebody in this group would review it before you submitted it
Cool.
to make sure the, you know, the quote derm doctor talk is right or whatever.
Bob said he'd do that. He'd be
Yeah.
willing.
Really?
Happy to, sure.
Thank you, Bob.
Yeah. And I'm sure American Journal would look at it. I'm sure Homeopathy Today would look at it.
I would think that the JAIH might look at it if it was properly written.
I'm one of the editors, so I could.
Oh yeah. Well,
They're always looking for material, and I mean, you know, yeah.
Well, cool. Thank you.
Okay, so is there any last comments or questions?
I see no questions or anything in the electronic world.
Well, thanks, guys. So we had two outstanding talks. Really great. Thank you so much. If anybody wants to give some talks and stuff, let me know. We have one taker for this October, and it looks like we may be having some others, so please let us know. Next meeting, before we close it out today, next meeting is going to be next month, May 16th, same time, 10 o'clock. That'll be Dr. Stephanie Chalmers. And then I think I'll be presenting possibly a couple of cases after that. So everybody have a great early springtime, and we'll see you in 1 month.
Thank you.
You're welcome.
Thanks, everyone.
That was amazing.
We were talking about presenting